There we go. Now we can see your slides and your recording started. So that's what you want. Mm-hmm. So then you know you're started because you can see yourself there. That's what they're going to see. Us in the corner, and then this whole screen. They'll always see that. So whatever you put on that.
And we can see that. Us. Good morning, everybody. Good morning, everyone. Thank you very much for coming. We're going to get started now. So I'm Rihanna Lopez here in the Flinders Careers team, and my colleague Philippa Spencer has organised and created this event. So thank you, Philippa, for doing this today. Also, our colleague Tracy as well has been involved in this event, so thanks, Tracy. We have you in the room, we have students online, we have, as you know, lots of organisations coming today. We have some who will be here in person, some online. So we're going to be having lots of people everywhere, which is wonderful. If you haven't already, please check in to the event using the QR code. And the Wi-Fi code is there as well if you need it. So some housekeeping. The bathrooms, you probably know, are straight down the stairs. And in case of emergency, you'll hear either a beep beep or a whoop whoop. And so with the beep, we just wait and see, and then if whoop whoop, we start to exit. And the evacuation point is the southeastern corner of this oval. I'd like to begin this event officially by acknowledging that those of us here today are on Kaurna Yata. I'd like to pay my respects to elders past and present, and I acknowledge that the land is unceded. It always was and it always will be Aboriginal land. Today also, we're about to head into Reconciliation Week. So there's a lot of events and lots of celebrations and recognition coming into the next week. And Reconciliation Week commemorates two significant milestones in the reconciliation journey. The first was on the 27th of May in 1967. More than 90% of Australian voters chose yes to count Aboriginal and Torres Strait Islander peoples in the census. The 3rd of June commemorates the High Court Mabo decision. So I'd just like to, again, acknowledge the special week that we're coming into, and we look forward to continuing our reconciliation journey. The format for today, thanks Philippa, is you'll see that we have organisations, employers coming and speaking to you about their organisation and the jobs and recruitment processes that they're going to share with you. So they will each present some information and allow some time for questions. With the questions, we do ask if you could keep them broad so that they're questions that, you know, might apply to all of you. If it's a more specific personal question, then could you please either, wait and chat to them at a later point, or send them direct communication via email or however they tell you to do that. So if it's circumstantial, that I'm this circumstance, could you please wait and ask that directly? So questions do need to be the broader questions. Thank you. Now, if there's nothing else from this, we'll get started. With the first presentation. I'd like to welcome Corey Slater, and Corey's online. Corey is the Nurse Manager, Strategy, Leadership and Development, Nursing and Midwifery Directorate in the Far West Local Health District in Broken Hill Hospital. Corey, thank you very much for coming online today. So now, Corey, I'll hand to you, and Corey will share his screen. And Corey, we've we'll stick to time. I'll give you a bit of a warning when we've got a few minutes left.
Yeah, no, that's okay. Thank you.
Thanks.
So thank you for the warm introductions and having myself here today and the Far West Local Health District, or on behalf of the Far West Local Health District. My name is Corey Slater. I'm the Nurse Manager of Strategy, Leadership and Development for the Far West LHD. There are quite a few different bits and pieces that fall under my working portfolio, one of which is the Grad Start program for nursing and midwifery for the LHD. So today's presentation will take you through a little bit about the LHD, a little bit about New South Wales Health, and importantly our grad program and why I guess a rural and remote graduate program is quite unique, and how within our local health district it is that extra level of unique as well. So to begin, I'd also like to complete acknowledgement of country. So in the spirit of reconciliation, the Far West Local Health District acknowledges traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So from here you can see a little bit about where we're located within New South Wales. So it is quite a large local health district. We cover around 195,000 square kilometres, and we border 3 states as well, being one of which being South Australia, and in Queensland, and then also Victoria on the lower sector as well. We do have quite sparsely populated areas. So around 62% of the 30,000 roughly inhabitants of the region or of the local health district live within Broken Hill, or some call it the Silver City as well, and others live in stations and remote sort of towns and communities ranging from 80 to 800 people within the area itself. So we are one of the 15 local health districts within New South Wales Health, and we are by far the most rural and remote, and I guess that sums it up in the name of being Far West as well. So a little bit about our services as well. So we have around 800 staff that work across the 9 facilities. So this includes the 6 public health facilities, 2 multi-purpose services and a primary health care centre as well. So Broken Hill Hospital is the largest within the region, being our base hospital. And it works quite closely with stakeholders such as the Royal Flying Doctors Service, Aboriginal health services such as Marimar and Camilla Health, and other primary healthcare networks as well. Because of where we're located, we do work very closely with our South Australian partners to provide that high level of specialist care for medical retrievals and some visiting services as well. So I will take you through each of the facilities, and it is just a very high level summary of the services and those bits and pieces that we offer. So the Broken Hill Base Hospital is a 98-bed rural teaching hospital. It does offer that wide variety of services, including 24-hour emergency, and it is the base for the maternity services within the local health district. We do have 16 3-month new graduate placements here. So later down in the slides, I'll show you an example of the rotation roster, and that shows how the rotations basically work, being that there are most likely within the program 4 3-month rotations. Depending if it's critical care or acute care, we're rotating out into some of our sites, or specialty programs such as mental health and operating theatres. They're 12 months, so it just depends on the specialty, how long you'll sort of be in each location and each specialty, and it then links into your second year program as well, which I will get into. There are multiple clinical nurse educators for various specialty areas within the base hospital, and this is where our dedicated district new graduate support clinical nurse educator is also based, which we'll get into a little bit more detail later in the slides. So I won't read off all of the different services that the base hospital offers. Basically, if it's not offered here, then they'll refer to South Australian Health, or other areas within either South Australia or within New South Wales as well for different services. Generally, if there's no services or a service isn't offered within some of the multi-purpose service sites or within our remote health service sites, then it should be offered within the base hospital itself, and we'll allow and facilitate consumers from different communities to come and receive services and then go back to their communities within our region. The Broken Hill Community Health Centre, so upstairs is, I guess, the headquarters of the local health district. It's where my office is, and a few of the other senior managers and the directors and the chief executives sit here as well. But downstairs is where the community services are offered. So that includes child, youth and family health services as well. And we generally have the 2 3-month new graduate placements here. Some of the other services that are offered as well. So moving down towards the southern region, more towards the Victorian border of the local health district, is Balranald. So Balranald Health Service is a multi-purpose service with a 24-hour emergency and hospital services, as well as residential aged care and a range of primary and allied health services. So it is probably the second largest facility within our region, and when I say multi-purpose service, it is multi-purpose, so it does cover a lot of different services that aren't covered, for example, in some of the smaller health services within our region. And multi-purpose services generally also have that residential aged care component. So to work within this environment is the skills you get are quite broad and also quite specialised as well. So you're caring for residential aged care residents, but then there's also an emergency department, which is quite small, but it's still quite busy. And then you've also got acute beds, and then you've got community services, which include sometimes maternity services as well as the general primary health care. So they are kind of like, in a way, mini tertiary facilities. It's just that they haven't got the large bed numbers or the very large FTE or employee numbers across them. It's a lot smaller because of the community size as well. So we generally have the 3-month new graduate placements here as well. And in terms of support and learning and development support, we also have a district clinical nurse specialist grade 2, which is kind of like a clinical nurse educator position, but is more specialised in providing that rural and remote education and learning and development support across multiple sites within our region as well. These are some of the other services that are offered here. So Boronga is quite a new facility, which is also right next to Mildura, on the Victorian border, and it provides services, mostly primary healthcare services for obviously Boronga, but then Detton, Gold, Wentworth, Houston and Balranald communities. So we don't currently have a new graduate program here. It is more of a second year and beyond transition to specialty practice program that we offer, and these are some of the other services that are offered within the building itself, and a lot of outreach services as well to those communities. Moving, I guess, as far east as the far west goes, is Ivanhoe Health Service. So it provides on-call emergency and a range of primary healthcare and outpatient services. Uniquely within the Far West Local Health District, our remote health services such as Benindi, Ivanhoe, Wilcannia, White Cliffs and Tibooburra actually provide the ambulance service for the communities and the region. Broken Hill and Balranald and the other two areas, don't offer New South Wales ambulance services because New South Wales ambulance is co-located within these areas, but for the other areas such as Ivanhoe and India, the ones I listed, the nurses working within these centres or health services actually provide the ambulance service. This is done through training and accreditation through New South Wales Ambulance, and new graduates are actually able to partake in this opportunity, receive the training and then act as a second responder to a first responder who will be the senior RM on duty, who sometimes has more advanced qualifications, for example, like first line emergency care courses, so they have an actual additional scope of practice when working in the rural and remote communities. So we are the only local health district in New South Wales Health to offer that service, and we've really embedded it within our new grad program and learning and development opportunities, including transition to specialty practice programs for all rural and remote, and I guess pre-hospital critical care specialty as well. And we're always looking for improvements and, I guess, changes in models of care and service delivery with New South Wales Ambulance, and even mixed workforces, so looking at paramedics coming and working within facilities, and us working within the ambulance and working together, I guess, in different specialties, but with the same foundations to provide services to our communities, which is really exciting. Moving to Menindee, very similar to Ivanhoe, provides that on-call emergency, which I've touched on, and a range of primary healthcare and outpatient services, and you can see some more of them here as well. Toowoomba, so this is as far north as the far west goes, and this is right near Cameron's Corner, which is the three states where they all meet. And it also provides the on-call emergency and regular primary and allied healthcare clinics. So within these health services, we do try to have at least one new graduate rotate through for the 3 months, sometimes two, just so there's sort of that peer support and a buddy system as well. And we find that new graduates really love these remote health service areas because of not just the skill sets they develop in the learning and development, but also personally as well. They're very tight-knit communities, they're very welcoming, and there's lots of fun events to do on the weekend and even after work. There's always sort of something to do in these areas. And again, they're very welcoming and very kind communities as well, which is always nice. And some of the other services that are offered. Just on some of these services, so with visiting services, we again partner very closely with RFDS, so the Royal Flying Doctor Service, who will run general practice clinics each week within these services. And then any patients that are, or consumers that are requiring hospitalisation or transport through medical evacuation, that's conducted through the Royal Flying Doctor Service as well, and that is obviously in partnership with the nurses who are working within the ambulance service sector within these sites. So you do get to move across a lot of different specialties and a lot of different services in any given day. And there's also visiting dentists, there's visiting allied health, there's a lot of visiting services because they're, I guess the communities aren't large enough to have services based there all the time, but that doesn't mean they don't get the services provided to them that they need when needed as well and on a regular basis, which is it's quite an interesting, I guess, model and service delivery of care, but it works very well, and we're always looking at improving it and making sure the communities that are very rural and remote, sitting within like a modified Monash criteria, which is the levels of remote, how it can be, of up to a 7, for example, for Toowoomba. So, but the community feels very safe and they feel very connected via the models and the services that we run, which is always good to hear as well. Moving down to Wentworth, so this is a small rural hospital currently undergoing a $30 million redevelopment to have, instead of just a nurse-led first aid service, more of a urgent care set up with visiting medical officers and virtual models of care as well, so that's really exciting. And we have new graduate rotations that are based here as well. These are some of the other current services that are offered, but with the new redevelopment opening in around September this year, there will be a lot more services added to this. Current new graduates that are rotating through Wentworth Health Service have been very involved in the redevelopment, as well as second and third and fourth year nurses, as well as obviously the senior nurses who have been there for some time, which has been a one-off, I guess, lifetime opportunity to be part of opening and redeveloping a new hospital. I was lucky enough to also be acting within the general manager role for Remote Health Services for around 4 months this year, and was able to be involved heavily within the project itself and the redevelopment. So very exciting times for the local health district with all the redevelopments that are happening with Wentworth and emergency department at Broken Hill-based hospital, as well as the mental health inpatient unit in Broken Hill as well. So moving to Whitecliffs, very similar to Ivanhoe in terms of services that are offered as well. Wilcannia, multi-purpose service, generally has a few new graduate rotations here as well, and again offers that 24-hour emergency and various primary healthcare and allied health services. So this is the Grad Start program. It will make a lot more sense what I've been saying in terms of how the rotations work. You can see that there are generally 4 3-month rotations between the remote health service sites and then our acute placements as well. 12 months is, mental health is a 12-month program, being 6 months in the inpatient unit, 6 months in community, vice versa. We also have our rural metro exchange programs with our metropolitan local health district colleagues, including the Sydney Children's Hospital Network, as well as Central Coast Local Health District and South Eastern Sydney Local Health District. We do offer mid-year intakes as well, and try to give a diverse experience over the 12-month program to ensure you're developing both personally and professionally as much as possible.
And Corey, I'll just say, I know you haven't had as long, but we'll start to wrap up, as I'm sure you are anyway, but I just thought I'd say that. Thank you.
That's okay, that's all right. Applications can be done through Grad Start, through the New South Wales Health Campaign, or directly through myself as well. And I'll leave my contact details here and also with your teams there, just so we can continue conversations, happy to answer any questions as well. Just trying to see if there was anything else I really wanted to touch on, but I think I've covered a lot of it. And there's more details there as well.
Oh, thank you very much, Corey, and I do acknowledge you didn't get your full time frame, so thank you very much for still presenting so much valuable information and interesting. Wilcannia's a little bit famous, isn't it? There's a book written on a teacher, and there's a few things about Wilcannia that sounds like a fantastic area to work in. And just before I ask for questions in the room, for the online participants, we're just having, we had a little technical issue. So if online participants have any questions, please do email careers@flinders.edu.au, which you can see on your screen now. So sorry about that, but hopefully that will help you. And I encourage you to send any questions. So for those in the room, to start with, any questions for Corey? And Tracy's just going to come up with the mic to make sure everyone can hear.
I just had a question regarding the New South Wales Working with Children's check. Do we have to have that before we apply to Grad Start, or is that after? Because we have to do it in the state.
Yeah, it's generally after. So we've had a lot of individuals start with our Grad Start program, and we can even give a grace period where you can work up to 5 days without sort of having a New South Wales check, as long as you've got a South Australian check. So through the Grad Start campaign, that should be fine, because we acknowledge that you have to be in the state, and sometimes that's very hard to do if you're not living here already with your community and stuff like that as well.
Yeah, thank you. Any other questions in the room? And Corey, if we get any questions online coming in, we might forward them to you, so can get an answer directly. All right.
Yeah, that'd be great.
Thank you once again, Corey, for your time in investing in this, and I'm sure we all appreciate learning a little bit more and just having a think about maybe that's an option as a job. So thanks everyone. If we could give Corey a round of applause. Thanks so much, Corey.
No problem. Thank you all. Nice to meet you.
Thanks, you too. And now we're going to hear from Northern Territory Health, Michelle Dunham and Emma Worsley. So Michelle and Emma, thank you as well for joining us online. I'll let you introduce yourselves with your roles. And I think we're looking good with the slides. Yes, great. Okay, thank you so much.
Everyone can see that okay?
Yes.
Hello, my name is Michelle Dunham and I work for the NT Health Office of the Chief Nursing Midwifery Office, which is a professional lead for nurses and midwives across the Northern Territory. And first I want to give you a quick overview of NT Health, our patient demographic and the opportunities available for you in your chosen profession. NT Health is the Department of Health for the whole of the Northern Territory. So it's made up of 5 regions, comprises of 6 hospitals, and that's 2 in Durham Palmerston, 1 in Alice Springs, 1 in Tennant Creek, 1 in Catherine and 1 in Northern Boyle. And primary health care is provided in 74 primary health care centres, including clinics run by our Aboriginal community controlled health organisations or ACHAs. So while the Northern Territory population is quite small at around 257,000, our population is truly multicultural. Our patient demographic is very wide-ranging with over 200 languages spoken and a large proportion of those who identify as Aboriginal or First Nations. We provide services from urban to very remote settings, so a career with NT Health and life in the Northern Territory is anything but dull. For the reason we're all here today, the applications for the 2026 NT Graduate Nursing Midwifery Programme opens this Monday the 26th of May and closes in February 2026. So this is quite different than other graduate programmes. It's open for quite an extensive period of time. And the website, which you can see a clip of here, offers more information about expected time frames and timelines. So I really encourage you to read that. To be eligible to apply for the 2026 programme, you must have graduated or due to graduate between December 2023 and February 2026 for those completing in summer semester, be an Australian citizen, a permanent resident or a New Zealand citizen, or hold a visa with non-employer sponsored work rights prior to commencement. And for any of you who may be on a student visa 500, you can still apply, and I encourage you to apply, but you will need to provide us a letter of completion from your university, which can allow you to begin the programme if you haven't already got that on visa. The NT Graduate Programme is for all 5 regions across the Northern Territory, and soon we'll have the lovely Emma Worsley from Alice Springs joining us to speak to the amazing team down there and the programme at Alice Springs Hospital. And she'll also speak to some of the amazing benefits and incentives available to the grant programme across NT Health. So the website, which I've shown here, provides all the necessary information that you need, and I'll provide a link to that later on as well. And it's got information regarding the application requirements, the documents needed. And so we don't interview in the Northern Territory, so the application is wholly and solely based on the application form and the application documents. Really, really important that you upload those. It also provides information on the intakes per region and the places and the amount of places per region, key dates and timelines. So I really encourage you to have a read over that. And if you have any questions at all, please contact our office. We really encourage you to contact us with any questions because things change each year. So what happened last year might happen this year. And really encourage you to read it all before you submit and apply. So firstly, I would really strongly encourage you to be open to opportunities. So whether that's the location of the programme in a different hospital or maybe your preference rotations. So often I talk to nurses and midwives who maybe didn't get their first preference or maybe took a chance on an opportunity in one of the more regional hospitals and they gained so much from that experience. All rotations and locations offered in the NT offer a wealth of exposure and experience that is hard to find anywhere else. So like all of us Territorians, I encourage you to be open to adventure. So you'll see on the website that some of the places are quite limited, so I really encourage you to put your best foot forward with your application. So before you apply, I suggest that you read the website and then read it again. Have all the requested documents, so please do not submit an incomplete application. It's only going to hold it up for yourself and for us. In your cover letter, we want you to address the essential criteria of the job description, but we also want to see who you are and what you're interested in. With your referees, make sure that they are appropriate and responsive. The website has a list of appropriate referees, and I really highly recommend that you contact your referees by phone or email and request that they be your referee. Remind them who you are, remind them of the date that they oversaw you. Just remember those educators are being referees for many, many people, so it really does go a long way. And an unresponsive referee can really delay your application. And with your clinical placement reports, please make sure that they're the most recent ones and they meet the criteria on the website. So before I hand you over to Emma, here are some links, and we'll share those afterwards as well. And one of them is a link to that webpage that you saw earlier, which is all the information, and that application button will be live on Monday for you to get your applications in. And also the other QR code is a link to our NT Health Facebook group. And that's a really good way of keeping up to date with education, employment opportunities, and just what's going on in nursing and midwifery across the NT. We really look forward to receiving your application and welcome you to the NT. I'd like to thank Flinders for having us today. We love to see our Flinders students coming up on placements as new grads, and we have so many previous Flinders students who walk the corridors or in our executives and leading the way. So I'll hand you over to Emma. So thank you very much. I'll stop sharing, Emma, so you can start.
Hello everybody, my name is Emma Worsley. I'm part of the graduate education team in Alice Springs, and I've got Nicole Wallace and Chester Matthews with us, who are our student facilitators. Some of you may have even seen them on placement here. I will just get my slides up and running and take over from where the show left off. Bear with me. Everybody can see that. So this is a picture of our lovely March 2024 graduate intake. So we run a very special 12-month program here in Alice Springs. We have about a 250-bed hospital servicing an incredibly large area. So we work with medical retrieval who bring patients in from great distances. So very multicultural. Our staff and colleagues are extremely inclusive and welcoming. It's one of the most beautiful towns. I absolutely love living here and I'm very proud to be part of the team. So this is a cute little picture here who you would be working with. We've got Janita, our coordinator, myself, and again Chester and Nicole. So here at Alice Springs Hospital, we run a 12-month program. So we do 2 6-month rotations in different clinical areas, which I'll show you a few areas that we have available. It is available on a full-time or a part-time basis. We also offer salary packaging, starting salary of around $18,000, not including penalties. Alice Springs does offer some attraction and retention allowances as well, so working remote. And you are entitled to some relocation support moving here, so potential coverage of costs for accommodation on the way here. We offer, within the program, we coordinate several study days. We hold weekly and fortnightly case studies and debriefing. So you would begin your program with a large cohort of individuals, and then throughout the year, as more intakes commence, you meet more new graduates. So I think at the moment we have over 25 graduates, and with some more commencing in July. So you meet amazing individuals, and the friendships that we see people establish here in Alice Springs are like no other. So the most beautiful experience. I did my graduate program in Darwin and moved to Alice Springs 4 years ago, and if I could have my time again, I would come to Alice Springs for the experience. Sounds like I'm peddling it, I am a little bit. So you are entitled to up to 7 weeks of annual leave as an employee of NT Health, and as a graduate entitled to 6 months accommodation when you first move here. Which is amazing. So we've got a couple of different locations. There is on-campus accommodation and then a few other options very close to hospital around town. These are our rotations. We do have more clinical areas within the hospital. So not included on here are palliative care, NICU, maternity. We just don't have graduate rotations in there. So you've got a lot of options potentially, depending on what you might be interested in. And typically once you've completed the application process, as Michelle discussed, if you have opted for Alice Springs preference, your application will then come to our team. We usually like to give you a call, have a chat, get to know you and see what you might be interested in, and figure out what area might be best for you. So we usually offer 3 preferences of this list, and we will try to accommodate at least one of your preferences in this clinical area. So lots of choices, a dynamic, challenging hospital, lots of professional development opportunities, postgraduate study opportunities. So it really is a fantastic place to learn and work and progress your career as a new nurse. The team are available usually Monday to Friday and after hours. So you have a lot of clinical support from us, in addition to our study days that we coordinate. But you also have dedicated clinical educators in each of these specialties. So a lot of support with you if you need us. And I have got an email here if you do have any specific questions. That's our generic team email. If there's anything you would like to ask prior to the application process, we're more than happy to be contacted, happy to have a chat on the phone and see if we can help you out. And that's all. If there's any questions.
We have a quick question from a student who's asking about the accommodation in Broken Hill, and we also wanted to ask that about accommodation. I think you did touch on it there. What level of accommodation is available in Northern Territory and Alice Springs? The support's available.
I'm not sure if Corey's still present to answer for Broken Hill.
I think he's headed off. He had a plane to catch.
It's okay. So the level of accommodation, did you say?
Yes.
Yeah, so through the application process, all graduates are reserved 6 months on-campus accommodation. So that is sort of dormitory style accommodation. So a single bedroom but shared kitchen and bathrooms. So you just walk across the courtyard and you're in the hospital. So it's very secure, gated. There is parking available as well. That's quite cheap. It's probably, I think it's around $140 a week. And then we do have a couple of other accommodation options. We do have the new 113 building just down the road. So that's got some newer apartments if you've got a family or need some more space. And then there are a couple of other options very close to hospital, just not on campus. So 6 months usually is the cap for that.
And just wondering, Michelle, if Northern Territory has any options.
Yeah, just wondering if Northern Territory has any options as well.
Oh, yes, so the wider...
For Michelle.
Yes, sorry. So, yes, that's Alice Springs, has multiple options, and everywhere else is the same. Darwin has come on campus, single or couple options as well, which is on the RDH Royal Darwin Hospital campus. Catherine as well has some accommodation, which are both subsidised. And then with Tennant Creek and Go, they have accommodation options as well, and they're fully subsidised.
Okay, I have another online question. Mm-hmm. Does this year Alice Springs take international students? What are the requirements and documentation required to apply for a TPPP for international students? There is some of that in the handbook, I know, but perhaps you could just take that from the Alice Springs angle.
Student rather than graduate?
I'm presuming that's graduate that the person's referring to there.
Yeah, so as Michelle was saying, as long as we meet visa requirements, then we absolutely do take international graduates, yes. I think the only requirement is that the employees, for visa requirements, usually have to work full-time. So a bit part-time is not an option.
Yeah, and with that, I touched on the presentation, with the student visa 500s, because there is a limit to the hours they can work. Once they've provided that letter of completion, that they've completed their studies, that overrides that part-time component.
Oh, that's good to remember that. Thank you. And any questions in the room before we finish up? No? All right. Well, thank you once again. It's just so informative and helpful. Thank you very much for putting aside the time to present to Flinders students. And hopefully you'll hear from lots of them with the applications or questions.
Thank you. Bye.
Thank you. Good luck, everybody. Bye.
All right, so I'll just now switch over here. Thanks, Philippa. Thanks, everyone. Hopefully you're making lots of notes and thinking about things as we hear this exciting information. I'm excited. I always never know then, well, which town should I apply for? Because they all sound good, don't they? So it's great to hear from so many people today, and really help you in your next career steps. So now we're going to welcome Calvary staff, and they're here in the room, and I'd like to introduce and ask Hannah, Mel and Sam from Calvary to come up, and I'm just going to ask them to stand here. We've got some handheld mics, or one, yeah, we can share. And with the mics, we will, as you know, we do need to always make sure we're on the mic so everyone can hear and everyone online can hear. So thank you very much for coming in. Hannah and Mel and Sam, I'll get you to elaborate on your roles and the same sort of thing, share and then questions. So thanks very much.
Perfect. Well, thank you all for having us today. It's great to be here. We will do formal introductions. My name is Mel Schofield. I'm the Learning and Development Coordinator and the Graduate Nurse Coordinator at Calvary Central Districts Hospital.
Hi everyone, I'm Sam. I'm from Calvary North Adelaide. I'm the Peri-Op grad coordinator there.
Hi, I'm Hannah. I'm one of the grad supports at Calvary Adelaide Hospital.
And we're dressed, we do Fun Scrub Friday. We're not normally dressed with Highland cows and cute little ice creams and things on our uniform. That's not, unfortunately, part of our uniform. However, we do Fun Scrub Friday, hence why we're dressed up. All right, I'm going to kick us off. So we're going to talk about a lot of different things in our presentation today, and we'll give you an opportunity to ask any questions that you may have at the end. We'll go. I'm going to do it here so my blind eyes can read. So, the Kaurna people are the custodians of the traditional lands of South Australia, from Port Broughton in the north to Cape Jervis in the south. This includes the Adelaide Plains on which our Calvary Healthcare Adelaide hospitals are built on. Today we acknowledge that we're meeting on the traditional lands of the Kaurna people of the Adelaide Plains. We recognise and respect their cultural heritage, beliefs and relationship with their land, and respect their elders past, present. We acknowledge that they're of continuing importance to the Kaurna people today. So, what we're going to talk about, we're going to introduce you to more of our grad coordinator team. We have quite a good team across our side, across South Australia. Also going to talk about the 3 different hospitals that Calvary have in South Australia, things that set our grad program apart, and obviously why to choose Calvary. So this is our grad coordinator team. We've kind of grouped them in hospitals. So you can see at the top left, we've got Bianca and Sam. They represent North Adelaide. Got myself in the middle for Central Districts. Calvary Adelaide have Tanya and Emma, Hannah, Kate, Heidi and Rebecca, obviously being quite a large hospital. You have a large amount of support at Calvary. We have a lot of people who are on the floor. We have clinical supports as well as coordinators who are available to provide assistance for you, whether you need it. They can work shift work, so you won't just be 9 to 5. You have that support after hours. If you're having a messy late shift, you've got people who you can call if you need that on the ground support. All right, Calvary Healthcare South Australia. We're here to talk about Calvary, our hospitals that we have in South Australia, but we are a national organisation. Large number of different hospitals, aged care, virtual care, retirement care. We have a lot of things available. One of the benefits of being a Calvary employee is that you can transfer. So if you, obviously, South Australia's a great state to live in, but if you wanted to explore, you can pick up and transfer to a different hospital, to a different site, to a different state, to a different specialty area. When you pick up and leave, you take your annual leave, you take your long service leave, you take your sick leave, you take all those benefits with you. All right, I'm going to talk to you about Calvary Central Districts, which is great because that's my hospital. We are the only private hospital between North Adelaide and Gawler. We provide a lot of support to people from the Barossa Valley, from the Mid-North, from the Yorke Peninsula. We have a wide range of services. We are also opening a new hospital in the next coming years that will be co-located, very similar to what Flinders Private have with Flinders Public. We're going to be doing something very similar with the Lama McEwen Hospital, so that's going to be happening in the next few years, as well as all of these services that we have on offer. All right, I'm going to pass on to Hannah.
All right, I'm going to talk about Calvary Adelaide Hospital. That's also my home. I think you guys have probably seen the big blue building in the city. It's quite easy to see. It is the newest and biggest private hospital in South Australia, and it merged with Calvary Wakefield and Calvary Rehab Hospital into one service in January 2020. This is a whole, we have, it's a 344 bed facility. It is the only private 24-hour emergency department, and we have 2 levels of operating theatres as well as an endoscopy suite and angio suite, which is very exciting. The patient rooms begin on level 6 with a 20-bed ICU and cardiac unit, and then the wards go up from there. We also offer urology, orthopaedics, neurology, as well as rehab, which includes 2 gym areas, a pool and a mobility terrace. And this is some of the services that we offer. And now I'll pass to Sammy to talk about North Adelaide.
All right, North Adelaide is the flagship Calvary in South Australia. We just turned 125 this year, so we've been there, we're vintage, but I love it. We have got lots of services available, as you can see as well. Breast and endocrine, all the things that you might need to have a look at and think about when you're applying to what hospital you would like to do. We've got 153 beds, which offers an extensive range of acute and medical services, so we do pretty much from birth to death at Calvary North Adelaide. So we've got our Kimberley House chemotherapy unit, maternity and Mary Potter Hospice. Our maternity service sits alone on the 2nd floor and has everything from the birthing suite through to a 13-bed postnatal ward and level 5 special care nursery. And only registered midwives are eligible to apply for the unit as well. Okay. All right, so we've got our what's happening with our program. We've got our program starts in early 2026. We've got permanent employment upon completion of your program. We've got supported rostering for the first 3 months. Extensive 3 to 4 days of orientation. Like at uni, we have O Week. So we utilise that for your time. We do all the fun stuff that we can do before you start on shift. Our RMs rotate through postnatal, special care, nursery and delivery suite. We've got flexible rostering, flexible FTE. So we always say that we'd like you to start as a 0.8. That gives you a nice work-life balance. It's 4 shifts a week. Our clinical rotation, so our acute ENs will get a 6-month rotation, and then they've completed their program. For acute, we've got 2 12-month. We've got RNs, which are obviously times 2. We've got 12-month program, which you do 2 rotations each, and all periods we've got 2 rotations as well. But we also do some scrub scout. We do for full year as well. Supernumerary days, of course, we have those for each area, and depending on where you go, for Imperial, which is where I am, we have a little bit longer than what they do out in the wards. But again, if you need more time, it's a good conversation to have with your grad coordinators. We've got dedicated graduate coordinators, all of us, to look after you while you're here with us at Calvary. At the shoulder support from our GNTP team. There's no night duties for the first 3 months. And we've got monthly meetings with us, just for a bit of a touch base with your grad support team as well. We've got competency books, which everyone will have, depending on which rotation you have. You'll have a few more than some others. 3 full days of study days, and they're tailored to acute, peri-op and midwifery. Dedicated clinical educators also for the specialty areas. We've got peri-op, acute and maternity specialised study days, as we said, and trained preceptors that look after you as well. And they're going to be good clinical support just to help you on the floor. And of course, a graduation ceremony at the end of the year that we get to celebrate what you guys have achieved throughout the year. Oh, good stuff coming up now. We've got our applications open on Monday, the 26th of May. Our applications close on July the 16th. It's Eastern Australian time, so they will close before midnight. So think about, please don't leave to the last minute. It's always hard to miss out if you do. In July, our applications are marked and we hand mark every one of them, all right? So if we've got 700 applications, we hand mark them all. In July, we also commence our interviews, and we are, in August, we're also doing some more interviews because there'll be with 3 hospitals, we need to do quite a few. We contact your referee, so like the other slides said, or other people have said as well, talk to your referees, make sure that tell them that you're going for an interview, and you can give them a photo if you need to, just to remind them who you are. In September, we are we've got provisional offers to commence, and we'll continue to be offering our position, or continue to be offered until all positions are filled.
So a little bit about our application criteria. So to be eligible for a grad program, you must not have been working in the desired role for more than 3 months full time. So if you're applying for an RN position, you can't have been working for more than 3 months full time as an RN. But if you're an EN and you're applying for an RN, that's fine. We ask for a cover letter that we just want 1 page, and a bit of a hint there is to address Calvary's mission and values. Have a little look online about that and think about what you can bring to the organisation as well. We also ask for your CV, which includes your placement and employment history as well, and any volunteer work. And then we also ask for your most clinical placement report, your summative one as well. And then we also ask for your unofficial academic transcript, which shows your GPA. And then, like Sammy said about your referees, so we want 3, but 2 of them must be clinical staff from your placement that you've worked alongside. And 1 can be a manager, a clinical facilitator, or someone from your other, if you've got other workplace as well. So some quick resume and cover letter tips. Make it easy to read format, not like 8. We like to have it big so we can read it too. Ask someone to proofread your resume and cover letter too. They don't have to have worked in healthcare, but just for someone just to have a look at it. We do have a checklist as well that's on our website, so have a look at that, print that off, make sure you've covered all those checkpoints as well. References, like people have previously said, make sure they're recent, make sure they know they're going to be your reference as well. And then have a think about why you want to work for Calvary as well. And like I said, what can you bring to the organisation, and do our values align with your values as well? And an interview, I promise they're not as scary as you think they are. We do group interviews with about 8 to 10 people per group. It goes for about an hour, and we just go through some individual work, some clinical scenarios. It's all group work based to see how you guys work in a team. And there are no medication calculations. So offers, so we will ring you and we will let you guys know what your rotations both will be as well, so you can make an informed decision. You have 3 days to accept or decline that offer, and we will keep offering, like Sammy said, until all our positions are filled. From that, you then have to do a functional capacity assessment that everyone does anyway. You do your national police clearance, submit your immunisation, do all your onboarding. It is a bit of a process, but we will support you through that too. From there, you get the formal contract offer that you can sign, and then you can order your uniforms and start some e-learning as well. So some of the benefits of working at Calvary, we also offer a lot of financial benefits. We offer salary packaging with Maxia. We offer about $15,900 per year as well. We've got lots of different retail entertainment discounts, and we also have competitive pay rates, and we have just gone up a pay rate as well. We offer a huge amount of health and wellbeing as well, including discounted health insurance with Medibank and Bupa, fitness passports, lots of health and body, mind hub as well, and free access to counselling and support as well. We also offer a huge amount of learning and development. Calvary really want to grow if you're part of our team. So we offer the preceptorship program, lots of national leadership programs. We also have education partnerships with the University of Tasmania, and they will subsidise some of the postgraduate studying if that's what you want to do down the track. Family, we have parental leave, health insurance discounts, that kind of stuff. Career pathways, like I said, that we really want you to grow and develop as much as you want to as well. And there are lots of opportunities to work across Australia. We now have a national casual pool as well, like Mel said, so you can go all across everywhere. If you guys would like any more information, here is our link to our graduate nurse program. And I think that's it.
Thank you very much.
I have got one online question.
Great.
A student has asked, how do the ladies at Calvary travel to Adelaide and North Adelaide? Where do they park? Do you get public transport?
And I'll just give you another mic. This, you can just hold this little one if that's all right.
All right, so the parking, definitely in North Adelaide, it's free parking around the suburban streets. If you are on a night duty or late and you are coming out late and your car's parked down the street a bit further, we do have security to come and take you to your car as well. For Calvary Adelaide, what do you do, Hannah?
We have street parking as well, paid parking, but there is also some work in the background with some trials of subsidised parking as well.
Did you say about public transport?
There obviously is public transport, definitely for the city, definitely is easier. North Adelaide, there's a bus stop that comes right outside the hospital, so if you do want to catch public transport, buses in particular, that they definitely is available. And Mel, you've got free parking.
We've got free parking right out the front any day, day or night. It's pretty good.
Thank you. We've got a question up. Sorry, we've got one ready to go. Sorry.
So when you apply, how are the preferences decided?
We actually ask you, so in your application form, we'll ask you a couple of different questions that are compulsory mandatory fields. So the first question will be, which hospital would you like to work at? So for us, you put in one application to apply for all 3 sites. We ask you which site is your first preference. So that's your first question, is which hospital would you like to work at? The second question is, what areas would you like to work? Again, mandatory fields 1 to 9. Do you want to work in angio? Do you want medical, surgical? Then if you select peri-op, what area of peri-op would you like? Would you like anaesthetics, scrub scout, recovery, day surgery? What is your preferences? We will then try and interview in those groups. So we'll interview a group of medical people who are interested in medical ward as a cohort. Likewise for any of our specialty streams. So we particularly focus on what you would like, and we take that into consideration when offering our interviews and then obviously the positions.
Okay, that's good to know. Thank you. Great, thanks.
Yeah. According to what you have explained on the screen, it says you should have 2 clinical referees and another referee.
Yes.
But on the handbook, it says referees need to be from 2 or more separate clinical placement experience, like 2 different places. So does that is it preferred way of doing it, or it does?
We have previously got some references from people's time at a retail outlet. We just want to know how you are as a nurse. So essentially, we want placement experience. Ideally, if you've got 2 different placements, that would be fantastic, but we're really looking to see your clinical experience. You may be the best person in your current job. We would love to know how you are in your placements.
Gotcha. If it's just like the recent one, just from one place, that's fine, right?
Absolutely.
Awesome. Yeah, okay, cool.
Thank you.
Okay. All right, so 2 clinicals. If you've got different ones, then that's great. Yeah. Can you just hold for 1 second, because we've just got to have the microphone. Yeah, thanks. And we'll probably finish up with the questions, I think, unless there's an urgent one.
Do you look at preceptor forms? So, yeah, fine.
All right. Yeah. Great. All right. Well, thanks very much. Very informative. Thank you, everyone. Thanks for coming. Thank you. That's great. Thanks a lot.
If you can just remind people to submit questions. I'll just bring that up again.
Thank you.
Yeah.
Great. We'll just give a reminder to the online participants. You can email the questions through careers@flinders.edu.au. And as you can see, we are answering those questions. So I encourage you to keep doing that. And great questions here as well in the room. Thank you very much. All right, so we are now going to hear from Jamie and Kaz from ACHA, which is Flinders Memorial and Ashford. So Philippa, yes, thank you Philippa for that, and we'll grab a microphone.
Okay. And you're welcome to stand here as well. So technical.
Yeah.
I was just explaining to Jamie on the way here that I went to Flinders 20 odd years ago, and I'm pretty sure I had some lectures in this hall, and I went through the day where there was no turner in, and down the bottom of the car park there was the office where you had to physically put your assignment into the little drop-in box. That was our drop-in box, and you had to type it up and then put it in there before 5 o'clock on your the day that it was due. So that's how old I am.
Technology's come a long way.
Can you all hear me okay? Because I actually can't hear. Okay, beautiful. So I'm Kaz, or Carrie Ann. I'm the Staff Development and New Grad Coordinator for Ashford.
And I'm Jamie McNeil, and I am the Staff Development Coordinator for Flinders Private Hospital. I job share the role with another educator, Calvary, who you also see around, and she manages a lot of the graduate nurse stuff. She is rudely away in Japan on a holiday at the moment, though, but you will see her around as well. At our site, and then Rebecca.
Yeah, and Rebecca is from Memorial. You see us amongst all 3 sites, so even though we have our dedicated office in a particular site, we do help each other out and come across to all 3 sites. So you will get to see all of the education team throughout your entire year in placement. So we're here to talk to you about ACHA and why you would want to pick ACHA, and that's the 3 hospitals of Ashford, Memorial and Flinders. So come and join us. Okay, so we've got the 3 main hospitals, which I've said before. We're private, not-for-profit, and we're proud members of the Adelaide Community Healthcare Alliance Incorporated, which is the ACHA bracket. So you're able, a bit like the Memorial, with the Calvary guys, you can transfer between all 3 sites if you wish. When you put your applications in, again, it's the same, check your preference, but if you want to move amongst the 3 sites, that is absolutely fine as well. We partner with the large private hospital groups and provide national education programs. So we are very closely affiliated with HealthScope. We're not owned by HealthScope, but we utilise them a lot in how we run our workshops and our education. So some of the education opportunities that you get may be interstate, and we will send you interstate if there's a particular thing that we need to that is HealthScope specific. We also have got, is there any midwives in here? Great. We have also got a newly midwifery grad program starting next year, and it's going to be very exciting, and a lot of that will be based for orientation, will be based in New South Wales as well, so you get to do a bit of travel at the same time. So Ashford, so we're the second largest private hospital here in SA. We've got over 1,000 staff, and majority of those are nursing. I'm not going to get into the whole redevelopment side, but it is redeveloped, and we are doing some more redevelopments as it comes across. We've got a massive range of services that we provide: medical, surgical, oncology, cardiac. We've just started the 24-hour chest pain unit, which has been absolutely amazing, and angio suite. We've got a emergency department. We're the only, Ashford's the only private hospital in the ACHA group that have an emergency department. We've got a critical care and emergency department, maternity, nursery, peri-op, anaesthetic recovery, scub scout, and we've also got a day procedure unit as well. Do you want to talk about that?
Yes. So at Flinders Private Hospital, we have 152 beds, approximately 130 staff, with over half of those staff being nurses. We were built in 1999, and we are literally linked via a corridor to Flinders Medical Centre. And at Flinders, we do have medical, surgical, oncology there, as well as our cardiac, medical and surgical, and our angio. We do also have a cardiac emergency care centre there as well. And then we also have peri-op, your scrub, scout recovery, DPU, and our critical care unit, as well as our paediatrics.
And Memorial is also heritage listed, so it's just turned 125 as well, 1920.
Quick maths.
Yeah, okay. Math is not my strong point. You can get nursing without math. So they're a smaller hospital in 100 beds. Again, majority of their staffing is nursing. They've got a really big paediatric surgical unit that they do there, specialised surgery including ophthalmology, orthopaedic. They do plastic surgery and ENT there, so that's set aside from the rest of the ACHA hospitals. Critical care neurosurgery they do there as well. They've got really good ortho spine and rehab they do there as well. So there are 3 sites in a bit of a nutshell for you. So our graduate program streams, so we've got general, peri-op and maternity for the midwives in here, and you'll get to rotate between all of the different areas within those streams. So if you want to go down the general stream, you can do critical care, emergency, and all of the other wards at the hospital. Have peri-op is going to be all of the theatre required, so that's scrub, scout, anaesthetics, recovery, day ward. And maternity, you get to rotate between the 3, antenatal, postnatal, nursery and labour ward. So our program, it's a very big preceptor support model, lots of paid study leave. Your orientation week alone is about a good week. Then you get your supernumerary. Supernumerary will depend on the location that you enter. If you're in theatres, you obviously get a longer, and the critical care, you get a longer supernumerary than what you do in the clinical wards, but it's still a very supported environment, and if you need more supernumerary time, we can offer that as well. Again, we're a 12-month program, and we offer full-time employment at the end of your contract as well, at the end of your 12 months new grad program. And again, we prefer to have a minimum of a 0.8 FTE, just so you can get the best out of your placement. But again, if you are struggling at that and you need to negotiate that with your manager, it's something that we can accommodate as well. So you get your 2 6-month rotations, and then a consolidation year afterwards. So even though you finish a new grad program, we still get in contact with you for the next year. Is there anything else we can help you with? Do you want to develop your studies even further? How can we help you progress your career? So we still work closely with you even though you finish your new grad program. We like to facilitate the experience of what your clinical areas you want to work in that is going to meet your career goals. So I've just gone through your paid program days, and again we've got a nice big graduation at the end. Everything's catered for. All of your study days we cater for as well, including any dietary requirements that you have. Salary packaging, we go through access pay, and that's $18,500 for salary sacrificing, and then you get a lot of more other, so you can claim your car park in and all of that on salary sacrifice as well. Part of salary sacrifice, you can get your novated lease. We also have a staff education research fund, which you can access $2,000 to be able to further your own education as well. So we've got EAP fitness passport, which can be used nationally. We like to develop and further your and accelerate your career as we see fit, and you want to further that as well. Lots of scholarships that we can offer if you want to further your study. If you want our jobs in the end of the day, you're more than welcome to, and we can tell you what education you need to do for that. And then, internal transfers if you need to, so we can fix you up with other HealthScope sites if you need to move for work, or your partner's got a fly-in, fly-out job, or you need to relocate, that's fine. Very flexible and family-friendly. We've both got a very young family and very flexible with us and our work environment.
I do just want to touch on as well, sorry, don't know if I need the microphone, I'm pretty loud speaker anyway, but just going back to the scholarship, so when you said if you want our jobs, in order for me to get this job, I did have to do a postgraduate certificate in nursing education, which the hospital actually funded for me to do. So they were extremely supportive, and that's something that we really want to emphasise as well, is ideally at the end of the day, we want you guys to stay within our hospital and within ACHA, and we want you to be passionate about the area that you're working in. So if you do happen to do your grad program in an area that you think, oh look, maybe it isn't for me, maybe I sort of want to transfer either to another hospital within ACHA or even just another ward within the hospital, we really do our best to sort of accommodate and facilitate that, because at the end of the day, we want you guys to get the most out of your career and be working in an area that you really do feel passionate about. So, so the hospital is extremely supportive in, getting you to have further study and sort of work towards that career that you end up wanting to be in the next sort of 20, 30 years, 40 years time maybe. So, yeah.
So the application process is very similar to all of the other sites. You apply online. There will be a QR code that'll pop up there shortly that you can register your interest. Interview, we're just trialling whether or not we do or don't do references, so bear with us for that one. I'm not completely sure whether we are going to do references this year. We just ask you a few more clinical questions in your interview just so we can get an idea of where your brain is at. We do face-to-face interviews with a panel of nurses, so you'll have one of us on the panel with you, and then the nums of the areas that you are interested in work in that you've popped through in your application. And then we start the onboarding process, and then you get your first day at the hospital. So these are applications. They're not open yet. They will open in August. So if you don't mind doing the QR code, if you are interested, and just if you express your interest of you wanting to be informed when the ad is out, we will send you an email that you've popped down on your interest form here. Pop down your personal email or an email that you find easiest to check so that we can capture you in a timely manner. And I think I'm running out of time. And there's our career page, but pop your registration forward and we'll get you through to our applications. Does anyone need me to go back to that QR code?
Yeah, that's a good idea.
Okay,
There we go.
I have some questions from the online audience. So how does GPA weigh in on your recruitment process? How many vacancies do you have this year for your graduate program? Do you take international students?
We definitely take international students as long as you've got the appropriate visa to be able to work. We absolutely take international students, and we don't preference international over national or national over international. It all goes on your application and your merit of how you've applied and how you interview. So there's no preference whatsoever over that. When it comes to numbers, we're just discussing that, in the process of discussing that now. I think between the three sites we took 70.
I think it was around 70
last year. So we're looking around that same number. And there was another part to the question.
How does the GPA affect the recruitment process?
To be honest with you, I don't look at GPAs when I'm interviewing you. I go off how you interview, and I like to see the feel and how you answer the questions.
That's sort of the most important thing, is obviously we are looking at the GPA and your resume and all that sort of thing as well, but the most important thing is obviously your clinical experience and how you actually interview and answer the questions. So.
Thank you, that's very helpful. Just while we have a question in the room, I will just encourage you to do what Kaz said. If you are interested, express your interest. So do that. Because sometimes people think, oh, I'm not sure. If you're interested, express your interest.
And if you've got another job lined up, that's okay. When I did my grad year, I applied for everywhere and I just picked which one I wanted. And that's okay, we expect that. All we ask if you have accepted another job is that you just courteously ask, let us know that you've applied or if you've accepted another role, so that I just don't have to keep calling you and saying, I'm ready for an interview or whatever.
Yeah.
Okay.
So you can
just a bit of professionalism around that. But,
yeah, I think that's good. You can speak to me afterwards if you're not sure how to decline an offer.
Good morning. I was wondering about the parking at the different areas. If the contracts are ongoing after the initial grad year, and is it possible to have the rotation split across different hospitals?
Okay, so contract I'll answer first. So once you've signed your contract and you've finished a 12-month new grad program, you are a permanent member with us. So you can stay within, if you wish to, you can stay within any of the 3 ACHA sites. When it comes to splitting the rotations, I believe we can. It does get a little bit tricky, but absolutely we have our start days and our finish days and transitions around the same time, so absolutely. We also encourage, we're not going to tell you when to take your annual leave, but we also do encourage you to take a 2-week break in between your rotation just to reset and feel refreshed, because that fear of then moving to that next ward or rotation can get a little bit daunting. So we just ask, if you want to, you can just take that break and refresh. When it comes to car parking, there is car parking on site, on all 3 sites. Memorial's probably the hardest one, and a lot of staff do park in the entertainment centre, I believe, and you can get subsidised car parking there. And then car parking is subsidised in the other 2 sites. Quite close to the hospital. You don't have to pack a lunch to get to work from the car park.
Yeah.
And there's public transport on all 3 sites.
Yeah, at Flinders we've obviously got access to the train that literally rolls up, so for public transport, rolls up right out the front essentially, which is great. And
It's got great coffee at the station.
Yes, yeah. A few good options there. And then, obviously at Flinders Private we have the subsidised car parking as well available, so...
Okay, I have another question about how many midwifery places you have. How many midwifery places you have?
Can we just pause for a second? Can
Midwifery.
I just ask everyone to not speak between questions? So we've got an online question and then we'll come over here, and that's probably, we'll finish up the questions.
I'm not sure how many midwifery spots we've got coming up. We're in the middle of negotiating all of that with all of the NUMs at the moment. I would say we would like to take probably about 4, I would like to say.
And over here?
What sort of, with the interview, what sort of questions, what kind of level of knowledge, like technical knowledge are you expecting?
Yeah, I'm not going to expect you to answer as an RN 10 level or a very senior nurse. We would like to know that you can clinically and critically think, and we have a lot of scenario-based questions. Obviously, research the hospital beforehand and realise and ask. Always you'll get asked, why have you applied for a particular site or hospital? So just do a bit of research on what the hospital offers and what you can contribute to that. So that is always going to be in there. Conflict resolution is always going to be a question, but we do focus a lot on clinical questions and how can you clinically and critically think in the scenarios that we've given you. And as long as we can see that from a strategic point of view you are working through the scenario, that's all we expect at a level that you guys are as novice nurses. Yep. What would you do in this scenario? So a lot of the questions are, this is your patient, how are you going to manage this situation? Explain to me what you would do. Yeah. And we're all very friendly. This is how we are in the office as well, so we
won't be sitting there
we're clowns.
Staring
No.
answer, but
All right, last question. Thank you very much.
Just really quickly about that, you said the midwifery program is being new and changed. Is that outlined on the website, like what it involves?
There is that PowerPoint as well, but the midwifery PowerPoint. But
if you want to pop down, if you want to put your details in the registration thing and just write interested in midwifery, then we can send you the information for the midwifery one as well.
Cool, thank you.
Because this one, I do apologise, it is more directed at nursing.
Yeah, great. Thank you very much once again.
We should have some information. Yeah.
Thanks to both of you. Again, very informative. That's fine.
Technology.
Good
luck,
a lot.
everybody. Yes, thank you. We hope to see you at ACHA.
Thanks, that was fantastic. Thank you. All right, thank you everyone for all your questions and interest. It's really fantastic. So just before we have a little pause, do we have the students from the student associations here? Yes? And are you Caitlin? Yes, Caitlin, would you like to come out? Caitlin is the co-president of the Flinders Uni Student Midwifery Collective, as those of you doing midwifery may know Caitlin. And are you Zoe? You're the, yeah. And do we have nursing Zoe here as well? No, that's right. So Caitlin and Cara. Yes, thanks. They're just going to have a chat to you, and then I'll explain what's happening next.
Hello, so we're just on behalf of the Midwifery Students Collective. So we're a student-run club and we hold a lot of academic events, so provide academic support and lots of social events. So you're interested... So if you're interested, just follow us on our socials. So we've got some upcoming events and postgrad. If you're interested in postgrad midwifery, follow us for some information. Thank you.
Oh, good. So any teasers? What's happening? What's coming up?
We did have a PowerPoint, but it's not up there. But we have a midwifery ball coming up, and we have some midwifery merch, things like that.
Oh, great. And do you need any committee members, or do you need anyone else on your committee?
We do have our 2026 committee applications opening soon, so if you're interested, please register.
Yeah, that'd be a good way to meet other people, your future colleagues, your professional network. Because I'm in careers, I'm all about jobs, obviously. So think about, who you are, who you can meet, how you can join in, and then into the future. Thank you very much for coming up and speaking and introducing yourselves. That's great. The ball, is that the date of the ball? Or yeah. October, okay. So follow maybe and here. Now, what we're going to do is we're going to have a little break. We've probably got about 7 minutes, but I think we'll probably be all right if we're a few minutes over. So toilet, hydrate, have a chat, and could you please be back ready to start at about 10:30 or 10:32 with SA Health. Thanks, everyone. Thanks, everybody. Thanks for waiting just while we set up a few things and made sure it was all working. Thanks very much. And now we have SA Health. We have a few staff here from SA Health, so we've got a little bit longer for this session. But sounds interesting, lots of different areas and everything. So I'm going to introduce Stacey first from SA Health, and then she will introduce her colleagues. So thank you very much, Stacey, and to everyone else from SA Health for coming today. I'll hand it over to you, and then if you need us with support for questions, we'll step back in.
Excellent, thank you. Yes, so my name is Stacey and I work within the Department for Health and Wellbeing. Our team supports educators and TPPP coordinators across the whole of SA Health. So we have 13 LHNs and statewide services to roll out a centralised single application process for TPPP applications for nursing and midwifery. So we're going to talk you through a few things today, and there are quite a few of us here, so we're going to switch in and out, but that means you'll get to hear lots of different perspectives. What you should expect from us today is you should have an understanding of who we are and what areas of SA Health we represent. Alyssa's going to talk you through a 12-month roadmap of what you should expect from a TPPP with SA Health. And also you'll hear lots about working in rural and regional South Australia for your TPPP. We've got some special guests here to talk about a new specialised TPPP program that we're going to roll out next year, and that brings our specialised programs to 3. And then I'll talk to you about the application process, about what you need to do to apply and what you can expect through that and the important dates. And then there'll be some time if you've got any questions for us. So thanks again for having us, and I'll pass over to Alyssa.
Thank you. Thanks everyone for coming today. We appreciate your time and we hope that you get a lot out of this session. My name's Alyssa Bailey. I'm the Nursing Director for Education and Workforce from Eyre Far North. I'll show you a map of SA in a minute where you can see where that is. I'm based in Port Lincoln, so thank you again for coming here. Just before we get started, I just wanted to see, can I have an indication with hands for people in the room of midwives? Oh, you're at the front this year. Last year you were in the back right-hand corner, so that's fantastic. Thank you very much. And I do acknowledge that we've got some online participants as well, so yeah, easy, thank you. Okay. Okay, sorry, I'm just going to navigate the IT. So your TPPP experience, a 12-month roadmap. I don't know how you put a 12-month journey as a first-year registered nurse or registered midwife into a picture, but we gave it a go and this is what we came up with. So the road is windy. You can see the end destination, but I just want to highlight some really integral parts of the roadmap. At the first juncture, so that information and onboarding, you will be given a lot of information over the next 2 months. Obviously, on top of all of your studies and placements that you're doing, we now throw at you the fact that you need to apply for a position for a TPPP. So there are multiple information sessions that are being held by the regional LHNs and the metro LHNs as well. I would really, really encourage you that if you haven't already done it, jump onto the SA Health website and just type in TPPP, I think it comes up, or TPPP 2026. And you can navigate between tiles of midwifery, nursing. You can also look at the specific programs, which we're going to talk about a little bit later. You can also delineate between midwifery and nursing as well. So there is going to be so much information coming your way. Please reach out to the people that you're going to meet today and the contacts that you have and your university representatives as well. So we want this to be as stress-free a process as it can be. The onboarding process, so when you are, and if you are employed with us, the onboarding process is very thorough and detailed. I won't take you through a lot of information about that. I can tell you there's a lot of paperwork to get done, but I will just give you some advice that please be on to getting all of your documentation in on time. So as you can imagine, there's police checks and immunisation checks and all of that sort of stuff that needs to be done, but the onboarding is different kind of within each regional LHN, but we do have to abide by SA Health policies and procedures. The next part is the supernumerary days and study days, or PDDs that they are called. So when you come into the hospital, into whatever hospital you get a TPPP with SA Health, you'll be given a considerable amount of supernumerary time. We want you to feel welcomed, we want you to feel safe, we want you to know where the toilet is and the tea room and all of those really important things. So it isn't just survival of the fittest, it really is, we really want you to feel welcomed and part of the community. The professional development days that are held, so I can talk particularly to nursing, so there is approximately 10 professional development days. Again, each of the LHNs kind of do them a little bit differently, but I can speak on behalf of Eyre Far North, so we have various days throughout the year. They're all on different topics, so deteriorating patient, mental health, We have a 3-day e-name course, so that's run by the RSS, that's Emergency Nursing and Midwifery Education. We have a graduation day at the end of the year where everyone kind of gets together and we talk about what your future looks like as well. We do rotate the professional development days around in different sites, so you get the opportunity, like in some of the other regional LHNs as well, to experience different campuses and sites. The support for graduates, I'm not going to go too much into this because my colleague Steph, who will come up in a little while, she's going to talk to you about what support actually does look like. It's different for everyone, but it's something I'm very proud of that we do very, very well, is people do start their TPPP feeling as though they've got not only the education team behind them, but the colleagues and staff that work in those sites as well. You are offered experiential learning and rotations. Again, the caveat is it's different in every LHN, and I will just again loop back to the fact that if you go to the SA Health website and you can find the tiles, each tile will give you the information about what rotations are offered at what sites. Please start doing your research now. Start having a look around, book yourself in for the information sessions, reach out to particular coordinators if you've got information and details or questions that you've got, because this obviously is applications close June 20, so you need to get cracking with that. And obviously at the end of the road, after all of that, we hope that you're going to complete with your successful transition. It is a full-on year, it's very exciting, but can I just say this is the juncture where when we have our graduation day at the end of the 12-month period, it's not see you later. We very much still support all of our TPPPs. One of my TPPPs from the 2022 cohort has actually joined my team as a clinical nurse facilitator, so it's been a full circle moment for her. But you're part of the community forever, so it's not just a 12-month journey, it's actually longer. I will just go on to talk a little bit about the TPPP in the rural and regional areas. So I'm very proud of the TPPP program that we have designed and we run in SA Health. It's a combination of formal and informal learning and really allowing you the best experience for you to safely transition through to registered nurse, registered midwife. This includes a really robust support structure, and we promote excellence, really hoping for you to build that confidence while also really looking after your well-being and making sure that you're building that resilience muscle to get through that 12 months. In 2022, SA Health and the Nursing and Midwifery Office, along with the ANMF and coupled with industry partners, did a statewide review of the TPPP. So, just so you know, I'm a Flinders nursing student. I won't tell you what year I graduated, and I'm not going to tell you what year I did my graduate program either. But I wanted to let you know that a graduate program, which it was back when I did it, and a TPPP, they've been around for years. But as much as the fundamentals are still the same, SA Health did acknowledge in 2022 that we needed to make sure we were doing it right. We wanted to make sure it was evidence-based. We wanted to make sure that we were getting the best out of our employees and making sure that the transition journey was exactly what we needed it to be. So we're making sure that the 6 regional LHNs and the 3 metro LHNs as well are building something that is sustainable and building something that meets the needs of you, our future workforce. Where's regional SA? So this is South Australia, if you didn't notice. I'm lucky to live in the mustard patch. I did ask for pink, but it wasn't available, unfortunately. So Eyre Far North is the largest geographical area, but you can see up there that there are 6 distinct regional LHNs. Flinders and Upper North, York and Northern, Barossa Hills Fleurieu, who Steph is here to represent, River Mallee Coorong and Limestone Coast. So regional South Australia covers a population of well over 400,000 people. Now that was taken from a census back in 2021, and I don't know if you heard of a little thing called COVID, but when that came, we saw an influx of people moving to regional South Australia, so I dare say that that is a very gross underestimate of our current population. In the 6 regional LHNs, there are 63 sites. So that's 63 places that offer TPPP programs, both mid and nursing. Before I go on to the next slide, I just wanted to share with you some statistics. In 2025, there were 850 positions offered approximately across SA Health, nursing and midwifery. We received over 1,300 applications. Now, you all look like a smart group, so you can probably do the maths. There was quite a few people that didn't get positions. These were a mixture of reasons. Some of them actually withdrew and went to private. Some people went interstate. Some people deferred. I actually had one one applicant who failed a subject and didn't realise, so couldn't actually go to ARPA registration until mid-year. So, you know, there's a multitude of reasons why that can happen. Out of the 800 or 850, 900 positions, a majority of those, over half of them, are actually offered within the metropolitan LHNs. I can easily say, hand on heart, that the metro LHNs fill their vacancies first. That's understandable. Most of you live here in Adelaide and you want to be at the cool big hospitals because they have all the cool big stuff happening. I can tell you now, we're here today, Steph and I, to convince you to start considering what might be outside of the metropolitan areas. We have vacancies nearly every year and we would really like to see you maybe considering what we have to offer. So we've heard it all before. I'm not going to go regional. It's only aged care. It's fairly lonely, nothing to do. It's quiet, it's boring. There's no shopping. We've heard every excuse nearly under the sun. We're here to challenge that. We hope that you have enough information today to think about looking outside of metropolitan Adelaide, looking outside of your comfort zone. It's 12 months. You come to regional to try something, you will live an adventure, and I can tell you right now, I could probably list 10 people that have come for 12 months and they're still there today with their families. So let's start. There we go.
Excellent. This looks like it's going to work.
Okay.
You got Portia. You know the deal. Hey, every service is a new job. Call me back. We just thought you might get some friends up there, love.
So that was Portia Bradley. She was a TPPP in Streaky Bay in 2022, and she was the successful winner of the Nursing and Midwifery Excellence Award for Early Career Nurse for 2022 cohort. We're extremely proud of her. The reason we put her in here is not only is it a cool slide, but her story is pretty cool as well. Never been to Streaky, she'd never been to Eyre Peninsula, she's not at all like me. She's quite happy to just close her eyes and point to an area on the map and give it a go. She took a gamble and Streaky Bay was better for her, and she's been there for quite a period of time since then, but recently transitioned back to some metro to do some further nursing, but we're very proud of her. The faces that you see up there on the screen now, these are some of the faces of mid and nursing cohorts that we've had over the last few years. Some of them are locals, so some of them are people that have studied internally or through CQU or other tertiary institutions by correspondence. and have stayed at home in their comfort zone where they want to be. But some of them have taken a real gamble and done something very different and been the better for it. Nursing and midwifery in the regional and rural areas is both diverse and rewarding. It includes careers in areas that you might not have even thought about. Not only acute nursing, but Aboriginal health, aged care, community health, high acuity nursing, mental health, which we'll hear about a little bit later, midwifery, oncology, peri-op, renal services. I could keep going on. There is so much diversity to experience. There's also endless opportunities. I quite often get perplexed to the shock when I hear regional TPPPs speak to metro TPPPs. They are doing things in regional areas that metro TPPPs envy, and they've actually had sometimes, you can't do that. Well, actually we can. So some of the things that you'll see up here are I would say 90% of our TPPPs are successfully independently IV cannulating within the first 3 to 4 months. Doing it, it's expected. We don't have an IV cannulation nurse walking around. I'd love that, by the way. But we don't have that. They're all successfully doing that. You do get the opportunity to do other areas that are within the hospital. So if you are a little bit quiet, which that's one of the things that was sometimes a negative, you might get the day to go and have a look at renal or chemo or go into peri-op. You might get the experience or the assistance to do other areas. The skills and exposure that you will get will really exemplify your time management skills. In the smaller MPS sites, you're doing everything. You might be the registered nurse on with another RN and you're managing the aged care area, you're managing ED, you're managing the acute beds as well. The opportunities are endless, and I really encourage you to think about, could that be one of you up there one day? I'm now handing over to Steph, who is my colleague from Barossa Hills, Florida, who's going to talk to you a little bit about what does support look like.
Thanks, Alyssa. So I'm Steph. I'm the TPPP nurse educator from Barossa Hills, Florida. So I'm in that sort of green patch that circles around Adelaide and circles down to Kangaroo Island. It's really quite an amazing space. We do have the city not too far away. You can drive in and out. But we also really have those benefits of having some smaller sites and some big sites as well, where we've got some great opportunities, all of them, of course. Now, the supporting our TPPP nurses, and midwives, I think that's a really important part of any transition program, and I'm really happy to say that, as Alyssa said, we've had some reforms done to our programs, and that's something that we actually really do every year. We all sort of sit down and go, what can I do differently next year? Because that's part of reflective practice and that continuous improvement cycle. So all of our LHNs now have a dedicated education team that supports graduate nurses and midwives. They might also support students and other areas of nursing, but they all support the graduate nurses and midwives. Within those education teams, we have clinical facilitators. So they are amazing nurses and midwives who are the people who come around and go, "How's your day going? Let me help you make that bed." Or, let's go get a coffee. You look like you need a chat. They are invaluable support people. They're the person who you can ring and go, "I need a little bit of help with something." Some of the metro LHNs are really, really fortunate to be under one roof or perhaps two roofs, and they can, the facilitators can get to you easily. But out in regional, it's a little bit more tricky, but we are really adept at teams and having phone conversations and talking people through things. If there's no clinical facilitator around, the other really big piece of work that's going on at the moment is about how we support preceptors within our workplaces and grow our preceptor capability within our staff. So that is then you've got people in your clinical spaces who are there to support you and be that go-to person who you can go, "Hey, can you come and sign off my IV cannulation for me? I need someone to come and watch me do this." And they're the friendly face that you can ask to do that. And it's certainly, as I said, a really big piece of work that's going on at the moment. And they're around to be able to provide that support at the bedside where you're seeing your patients. Peer networking as well is really important. So as part of one of the really great things about the professional development days is that TPPPs coming together and being able to have those conversations about, the other day this happened and it's left me feeling this way. They're also around in your sites to be able to have a chat. They're also, there's lots of different modes where people get together and organise dinners or lunches so that there's that peer networking and support day. Support there. There's dedicated professional development days. Now that will look different for every LHN, I will say that, and every program. So midwifery is going to look different to nursing. And Helen will talk more about midwifery very shortly, but certainly within the regional LHNs we do ENAME, which is a 3-day emergency nursing midwifery education. And Alyssa was telling us before that one of her, at a previous session, or was it Carla, that one of their nurses had to assist with a delivery. And that was just amazing. Like, it's one of those things that happens in regional and not necessarily quite so much in a tertiary space. However, we do have those dedicated professional development days, and as I said, content and how we deliver it is reviewed every year. Next slide.
The Northern Nursing Midwifery Education team works across all 17 of our sites in Northern to support our newly graduated nurses and midwives, and also our enrolled nurse cadets, and all of our nursing students and midwifery students that work in our network. We have a really key team of level 2 for our clinical-based facilitators. They work at the elbow point with our students and with our graduate nurses and support them in developing that role modelling and what it actually means to be a nurse. Like, how do you put that into practice instead of reading it from a piece of paper? Then we have the level 3s and myself. We do lots of the more overarching type education. And as a team, it's very much what our focus and our collective process is to make people feel stronger and safer at work.
So success means building those relationships between the sites, the consumers and also the graduates. But real success is when we see those people go on and succeed in their career and are able to reflect that, and some of them come back into the education space themselves.
I'm passionate because it's about ensuring we give really good quality service and care to our consumers in our communities across York and Northern.
So that's the York and Northern team, and a lot of the regional LHNs have a very similar setup, which is just amazing. So living and working regionally, I'm just going to say I am a Flinders alumni as well. I grew up in Adelaide and moved and relocated to rural South Australia as a graduate, and had that. If you're going to move, don't move the week before you start. I'd move a couple of weeks before I start. That would be a hot tip. Because I did it the week before I started and then started full-time work, and it was really quite amazingly shocking. Please do consider moving a couple of weeks before so you get to know where the supermarket is and all of those sorts of things. However, living and working regionally is just amazing, and you really find a community when you go out to regional areas. You get to know people quite reasonably quickly, and they are curious about who you are. I think that's the other really thing about the regional communities, is they're like, who are you and how long are you here for? And they really want to get to know you. One of the great things about living rurally is that I don't have a crazy commute. So I left nice and early this morning. We were down here the other day for a session with UniSA, and it usually takes me a little bit over an hour, about an hour and 10, hour and 15. It took me an hour and 45 minutes to get home because there was a crash. I don't have that issue, generally speaking, around home. I live about 15 minutes from the hospital. It takes me a minute and a half to get from the car park into the hospital because I don't have to pay for parking. There's always a car park and it's just lovely. I will say Mount Barker is a little bit challenging at the minute with car parking. We are in the middle of a rebuild and so things are a little bit chaotic there. But certainly car parking is much more streamlined than perhaps some of the metro LHNs. The regional communities really care for their workforce, and they really do. I have heard some really beautiful stories about how health practitioners have been supported by the community, especially when, things have been a bit tough. But that's because we care for them. It becomes a two-way street, and it's a really beautiful relationship. And you have that really great therapeutic relationship as well with your patients, because you know that that's the patient that's in the room. That's such and such's grandma, or that might be the lady that lives 3 doors down the street, and you've noticed over the last few months things have been different at home, and I'm a little bit worried about her. But you do develop those relationships. The great thing about being regional as well is you get to be a tourist in your own region. How amazing! Port Lincoln have Tunarama. They do. The Barossa, gourmet weekends, gourmet vintage festivals. Riverland have some amazing things happen up there as well. York and Northern, there's the beaches. There's amazing things to do wherever you go. You've just got to look out for them. There's lots of flyers around. There's lots of opportunities, and there's lots of opportunities to get involved in the community as well. And that includes things like Country Women's Association, and I'm going to say there's a really big influx of younger people into those spaces now, which is exciting. And then there's always the sporting communities as well, which are hugely active. Some of the rural LHNs also have a pay incentive for going and moving and living regionally and rurally, but that is dependent on how far out you go, and that's according to the EB, so that comes out afterwards. Regional considerations. So we do say that you come for the work, you fall in love with the lifestyle, and then you want to stay. We have got a number of graduates within Barossa Hills as well who have sort of come out, or they've moved and relocated to Kangaroo Island. They become part of the community and they stay, which is a really amazing thing for Kangaroo Island and our communities. We do ask that you need a driver's licence and a reliable car. Not many of the regional and rural areas have Uber. Not many of them have buses that will get you to shift on time. And there's not really any trains. So you really do need to have that reliable car and a driver's licence to be able to get to work and get home at the end of the day. And I really do encourage you to look at where you are applying for. Really, without relocating, regional South Australia can be a little bit tricky if you're not going to move there. The isolation and social support. So some people do initially, they can be a little bit like, oh, what have I done? I'm here and I don't know anybody. But very quickly you do find people that you become friends with, whether that's through work or whether that's through other community organisations. Farmers markets are amazing places to go and meet people, have a chat, have a coffee. Everyone likes to stand around and have a chat about whatever is going on, and I think the drought is a hot topic at the minute. Housing. Regional and rural South Australia is not exempt for the rental crisis, I'm going to say that. So if you are offered a position at a regional or rural location and you do need to relocate, please get onto that early, because it can be quite tricky trying to secure somewhere to live. It might be that there's a couple of you looking at the same time, so that would be great if you could house share. But as I said, we're not exempt from that, so do get into it early, ring the local real estate agents, and don't just look in the town that you're going to go to. Actually look a bit broader afield, because it's, there might not be anything in the town, but there might be something in the next town which is only 10 minutes away. And then, as I said, incentives. There are incentives, pay incentives, if you decide to relocate. and live rurally. And for some LHNs as well, regional LHNs, they also pay, you may be eligible for relocation assistance. So we challenge you to be brave and step outside that comfort zone. Have a think about regional nursing and midwifery. It's really, really rewarding. Certainly, just phenomenal. I'm just going to say that you can go from 1 minute you've been looking after a patient who's beautifully stable, and then all of a sudden you'll have something walk through the front door of the hospital and you're like, oh, I must go manage that now. And then something else comes in. So there is never 2 days that are the same, I'm going to say that.
I went to university straight after high school, did my Bachelor of Nursing at Flinders University, and then was offered a TPPP program here at Cleve. I really value communication. I think having good communication with patients means you're able to understand their needs and then you can advocate for them really well.
Bedside handover has been a challenge to a lot of hospitals in our state, and I got Kiana on board and asked her to be the bedside champion, and she did a great job of it. She led by example as a junior RN and ensured that it happened in our site, which improves the patient and resident journey.
I've had a lot of comments of other nurses saying you wouldn't even know she was a TPPP. She's got that confidence, she's got that natural ability, she's so caring to be a patient cared for by Kiana. I think you'll feel really safe and comfortable.
I love how nursing has so many opportunities available, especially rural nursing, so I hope to do my X-ray course and suturing course. I'm really inspired by making a difference in someone's life, no matter how big or small, and I really hope to have a positive impact on everyone that I encounter.
So Kiana is hugely exciting, and she won the 2025 Excellence Awards, and she had lots of peers at the awards ceremony who and colleagues who cheered her on enormously, I'm going to say. I wasn't at the awards, however, I have heard that someone who used to work in Alyssa's team has come to work in my team, and apparently she was one of the loudest cheerers. Like, I'm really proud of that. Midwifery, I'm a nurse, so midwifery is something that I can talk to you a little bit about, but I'm going to hand over to the expert Helen Pollard, who is joining us today to talk about midwifery.
Hi everyone, as you know, my name's Helen Pollard and I am a dual registered nurse midwife. I currently work as the midwifery manager in the Women's and Children's Division, Flinders Medical Centre. So I'm here to talk about the TPPPs for midwifery. I have been involved with the TPPP recruitment process for the past 11 years and work very closely with our team who helps support the TPPP program at Flinders Medical Centre. I can't answer everything to the other LHNs because I haven't worked there, but I can talk to my own area in Sarlan. So the TPPPs for midwifery in SA Health encompass the whole state. So we have many regional areas that offer TPPP programs. I am a country-trained nurse, so I will second the statements about what you get exposed to in regional areas far surpass what you get exposed to in metro. It feels more protected within metro. So that can be an absolute blessing. I have very, very fond memories of things that I saw during my time as a country nurse, which then opened up what avenues my career took because of that. Within the metro area, we have the three major LHNs. We've got Sarlan, Witchen and Narlan. So it covers the north, central and south of Adelaide. Within Sarlan itself, we offer 12 TPPP positions for midwives. There's a lot more nursing, but for midwives it's 12. That sometimes can change. The things that you need to know within SA Health is that we are always evaluating and responding to what is happening in our community. And so numbers and figures and dates and all those things are always a moving beast and evolve in line with what our community needs. But 12 is what we have for Sarlan for next year. We likewise, as with the TPPP for nursing, we offer all the orientation, the supernumerary days, the ongoing support. We have dedicated TPPP coordinators that are employed to come around and help support the TPPPs. We do facilitate professional development. There are dedicated TPPP study days, but there are also professional development opportunities that lay outside the program. So IV cannulation, perineal suturing, water birth accreditation, fetal surveillance education, emergency management, all of those things are all offered throughout the TPPP program as well, as they are open to all midwives. Yeah, I think that's probably all I've got to say. And back to Seth.
Thank you. Do you mind if I just pause here? I just wonder if it's all right if we just have a quick stretch?
Yeah.
Yeah, while we swap over? Yeah, thank you. If you'd like to just stand up and have a bit of a wriggle, or just a drink or a breather, because you're doing really well. We're in the same room for the whole morning, so I'm just conscious that it's nice to just have a little bit of a stretch and, you know, all the ergonomic things that we all talk about. You doing all right?
So thank you, Helen. I will just say that we have got the slide up on the screen of where our regional midwifery locations are, and Murray Bridge didn't relocate to Airfar North. That's an error. So if you can just drop that back down to Riverland Mallee Curong, sorry, that would be amazing. And each of the regional LHNs have their own models, I think, is probably one of the big things for midwifery care. So please do take time to come to the information sessions and book into them, and come and have a chat. We've got another video.
Another video.
No?
I'm a registered midwife. I work with mums, babies and their families, anytime from conception through their pregnancy, birth and up to 6 weeks postpartum. I'm passionate about being a midwife because I'm really a champion advocate for women's rights, and I think it's really important in today's society. I love being with women through the most important, scary, exciting time of their life, and it's just an honour to be there through that.
Isabella was my midwife, and when I came into the hospital, I was quite stressed out. She came into my room and all of my nerves just went away.
Because of being a small country town, you end up being there, you're the only midwife on, and being there through my friends' births and my teachers' births, and just being with people that have had lots of losses and they finally get that rainbow baby is just amazing to be there to see that.
What a privileged position. So we challenge you to think about what actually nursing and midwifery in the country and in rural areas is. Living and being in regional South Australia, it's actually exciting. It is actually exciting.
as I said, there's no 2 days, no 2 shifts that are the same, because you never quite know what's going to happen. It's challenging. Just when you think, okay, I've got this, something else will make you think, oh, I've got to go and look that up. I've got to learn more about this. I've got to do that. It's Alyssa, I'm going to say, Alyssa, when she gets back to Port Lincoln, I think the nursing staff, the nursing midwifery staff are probably going to come looking for her, because she said the Q word. And she said it twice. Rural nursing is really busy. If you think you've got a peaceful day, I thought I had a peaceful day one day, and I came back and the number of the patients in the hospital had went within an hour from a very small number to a very big number, because there was an emergency outside of the hospital. And it's those days that you pull in everything you've got in reserve and knuckle in and help. There are great career opportunities within rural and regional South Australia, and building leadership skills is something that we do with our staff and with our colleagues, and it's something that we build from a very early stage, so that we are all confident in being able to lead when we need to. There are lots of specialties. As Alyssa said before, there's, some of our hospitals have haemodialysis, some of them offer chemos and infusions, some of them offer midwifery group practice, some of them offer dedicated emergency departments where other spaces emergency is built into the ward staff. So I really do encourage you to have a look at where you're thinking about going and figure out what rotations they do have on offer, because they are all different. And it's really personal. It's really very personal. You walk into the hospital and unless you go to a really big site, most of the time you walk into the hospital and you don't get away with not saying hello to somebody. You walk past somebody, you've got to say hello. Because you're a team, and that's one of the really big things about rural nursing. We will carry on. So if you would like any more information, if you've got any questions about being a TPPP in regional remote areas, please take a little QR code snap. That will go through. Alyssa's collating all of those, and then she'll pass them out to where they need to go, which is very, very helpful. Oh. Yep. There you go.
Excellent. Thank you, Steph. All right. Thanks, everyone. I appreciate our session is really long. There's a lot to cover, so I really appreciate your patience as we work through it all. SA Health is the largest employer in the state. We employ 50,000 people, so it's huge. Like I said, there are 13 individual employing networks across SA Health, and so the opportunities are really vast, like my colleagues have spoken about. There's lots of expansion. You will have seen in the media this week more than 2,000 additional positions than what we had previously. We just are continuing to try and enhance our workforce. And one of those areas, in particular in the south, is mental health nursing. So what we are going to talk about now is our specialised TPPP opportunities. Like I said, we will have 3 specialisations for 2026. There's research and TPPP combined for both nursing and midwifery applicants, and mental health nursing and aged and community care nursing. So the mental health opportunity in particular, because that's new, we've got some of our mental health colleagues here with us today to speak to you about the opportunities within mental health, perhaps what you might think of mental health nursing at the moment and how to try and challenge that. The mental health TPPP next year will be an 18-month offering, and the program will be structured in a way that the first 6 months you'll consolidate your general nursing skills into practice. You'll participate in an acute rotation, and then in the following 12 months you'll specialise in mental health nursing, and you'll also complete the graduate certificate in mental health nursing with UniSA. So that's something to really consider. There are a range of other opportunities that can further supplement this, like scholarships and things like that. But let's hear a little bit more about mental health nursing now. So if I can invite our mental health reps up. All right. So perhaps I'll ask you just to introduce yourselves as you go through and just share just a couple of minutes of your experience, opportunities and what our students might not yet know about mental health nursing.
Thank you, Stacey. It's interesting to see a huge audience here. I'm Joshita. I work as a nurse educator with Carlin Mental Health Clinical Program. And I've got my colleague here with me as well, Rachna. She works alongside me in Carlin Mental Health Clinical Program. And thank you, Stacey, for giving a brief overview about the TPPP program, what we are planning from mental health. But what I thought is, like, I'll focus a little bit about my experience working as a mental health nurse, which might help you in making that decision of, like, is this my right choice? Like, am I doing the right thing? Because you're in that crossroad of, like, making a choice, like, what am I going to do? There are so many specialties to choose from, and, like, am I going to be choosing the right one? And as you know, mental health nursing comes with lots of, probably the stigma attached to that, the fear factor attached to that. All these things are quite natural. I'm a mental health nurse for probably the past 25 years or so. I can say that, like, I'd been there at that initial phase. But as you step in and start working in mental health, it's very, very different. And majority of you would have had some placement with mental health nursing as an undergrad student, and you would have just seen the snapshot of mental health nursing or even like the mental health settings. But that is just like maybe 2 weeks or 4 weeks or 6 weeks experience, which is probably not much comparing to the experience what you can achieve with the 6 months placement or the 12-month placement or maybe through your career when you plan to work as like a mental health nurse. What I would like to highlight here is a couple of things. Like, usually when we talk about mental health nursing, we think, oh, it's just a diagnosis of mental illness, or like the people who come with schizophrenia, mania. That's not just mental health nursing. Like, we work hand in hand with the physical health aspect of the individual as well. And mental health becomes extremely important, because if the mental health is being affected, you can imagine like the whole aspect or the whole systems get affected, and like the whole physical and mental health of the individual can get affected there. And when we plan our care, what we do is like we focus on the individual approach or the consumer-focused approach and the trauma-informed approach, whereby we are giving the consumer the empowerment or the rights to make choices, and we are actually promoting the well-being of the individual there. So you might think, like, as a TPPP or like as a grad nurse who come to our services, what happens? Am I ready to do all these things? And we will support you in that journey. So that's something which I can assure. In Carlin Mental Health Program, like, we have got different areas, like both inpatient settings as well as the community settings. I'm not exactly sure where all the rotations will happen, but wherever you are going to be placed, you will be well supported by the team. We have, like, from the mental health side, like, we have got a designated nurse educators, we have got the clinical facilitators as well as the preceptors in the each areas. And preceptors may work with you, or if they are not available, always there are nurse consultants or the team manager, or sometimes even the senior clinicians who are working with you will be supporting you. So it's not something where you need to be like, oh, what am I going to do? I'm in the deep end. No. And another question usually gets asked is like the violence. Are the patients like, are they not really violent? Like, how are we prepared? Like, are we able to manage that situation? This is a basic of mental health nursing, where we treat the individual's behavior. All behavior is a form of communication. So we are addressing their needs or their distress rather than addressing the violence there. And you will be well prepared to face those situations. So it's basically our communication strategy or the communication skills which come out through that area as well. And as I said, like, there's enough and more support in the clinical areas when you come in to work in those areas, and it will be a more structured, organized way of doing with it. And after that, okay, you have done your 6 months or 12 months in mental health nursing. What are the career options? it's not just the acute inpatient areas, which is considered as the mental health nurses' work domains. There are a whole heap of areas where you can actually spread your wings to. It could be an inpatient unit. Again, inpatient unit is just a general term. There could be acute units or the intensive care units. There are transitional care units. Like, the areas are very wide when you come into mental health nursing. And if you think like, oh, that's not really the area where it works for me, probably community settings. Again, there are very different natures of community settings, and like they work from different perspectives. The scope of practice is different. Recently, even we have got the SAS co-responder programs where you actually go out with the SAPOL and the SAS and do the assessment of the consumers. Like, so that's probably may not be in the initial days of your career as a mental health nursing. So it's not just a dull, oh, what are we going to do with mental health nursing? There are lots of options what you can do once you become a qualified mental health nursing and mental health nurse. And what I found mainly as working as a senior clinician in mental health in Carlin, there are grads like you who come in through the TPPP pathway, and they initially will be like, oh, I didn't want to work there, but at the end of 6 months, it's like, I've made the right decision. I'm pretty sure Beck might support with that as well. So it's just like testing it out whether it works for you. For some people, it will be like, no, I'll not be in a position to work here, but it gives you an opportunity to see what are the avenues available. And once you get qualified, again, there are the career progressions available, just like in any other areas where you can become a clinical nurse, the team managers, or even like, just like me and Rachna, probably the educators or even the leadership roles will be awaiting for you. And there are lots of champion roles in the inpatient settings as well, where you focus on one aspect, like maybe the metabolic monitoring, or like it can be the violence and aggression. So the opportunities are plenty when you come to mental health nursing. So I hope I've covered some aspects of mental health nursing, but from TPPP perspective, I'm pretty sure the SA Health website gives you the application process and all that things. But coming into the ward, yes, you have got plenty of support and help available in a structured manner. Thank you.
All right, before I start, I'm just going to say I've come off night shift, so this could go haywire very quickly. So good morning. Before I start, quick question to all the future nurses. Hands up, who is here is hoping to get an ED, ICU, theatre rotation? Fair. Now be honest, who here is hoping not to get a mental health rotation? Oh, not many. Pretty good. Well, I was one of them that didn't want a mental health rotation. I graduated university in 2022, and I was lucky enough to receive my first preference in the Transitional to Professional Practice program at Mount Barker Hospital in the Barossa Hills Fleurieu Health Network. I was excited. I felt like I was finally stepping into a career I'd worked so hard for. 2 days before Christmas, I got my early Christmas present. The email came, my 2 rotations were listed. First, Mount Barker ward. Second, mental health at rural and remote. Boy, was I disappointed. I had experience with family members struggling with mental illness, and it had been draining, frustrating. Honestly, I didn't want to go through that again, especially not in my job. I wanted ED like most grads, something fast-paced, clinical, with cool stories to tell. Instead, I was picturing 2008 Britney Spears, shaved heads, padded rooms, and emotional chaos. But I parked those thoughts and focused on my first rotation, Gen Med Surg at Mount Barker. That's where I learned the fundamentals of nursing: ADLs, medications, talking with consumers, working in a multidisciplinary team, and just getting into the daily grind of real nursing life. It was hands-on and I loved it. As the rotation came to an end, I remember sitting in my mum's office, seriously trying to work out how I could quit my TPPP and just stay on the ward. I was ready to throw it all away rather than do my mental health rotation. Then my facilitator sat me down and said, just give it 4 weeks. If you hate it, you can quit. I thought, perfect. I'll do the 4 weeks, survive it, and go back to real nursing where I don't have to deal with feelings. Then came day one. I felt completely out of my depth and overwhelmed. These consumers weren't what I expected. They weren't lying in bed, ringing call bells. In fact, there were no call bells. Instead, they were walking around the unit, sitting in common areas, engaging, sometimes awkwardly, sometimes not at all. And there I was, wondering how I was supposed to nurse someone without a wound, a cannula, or an OBS chart. I shadowed a clinical nurse, and what I saw wasn't traditional nursing. He was simply sitting with someone, asking how their night was, listening, no interventions, no charts, just presence. I thought, is this even nursing? Day 2, same nurse. We started with a consumer experiencing depression and suicidal thoughts, and he just asked, have you had thoughts of suicide today? Have you self-harmed in the past 24 hours? I cringed. You can't say that to someone. What if you upset them? What if you say the wrong thing? I never learnt this in uni. But slowly, I found my rhythm. I started asking questions, the hard questions, and when it felt out of my depth, the team always answered. No judgment, just support. 4 weeks passed. My facilitator came back and asked, so are you staying or leaving? Without hesitation, I said, I'm staying. ED was a distant memory. I threw myself into learning more. I started reading the DSM-5, the giant book of mental illnesses and the diagnostic criteria, not because I had to, but because I wanted to understand the people I was caring for. I wanted to do better. One consumer I'll never forget came in completely shut down, was unable to walk more than 2 metres, bed to bathroom and back. Wouldn't talk, wouldn't eat. Day after day, I'd sit quietly next to her, checking in. Not pushing, just being there. Over a period of 8 weeks, slowly we saw this young lady go from writing us notes to speaking quietly, from walking 2 metres to walking a lap of the ward, laying horizontally to sitting up and playing card games, to seeing this young lady walk out of the ward with her parents. The night before she left the ward, she sat next to me and said, thank you for not giving up on me and believing in me when I couldn't see a way out. I was speechless. I hadn't done anything groundbreaking. I just kept showing up. But to her, that was everything. After my TPPP, I applied for a grad dip position and got the job. I continued to grow as a nurse and grew my skills and knowledge base. And eventually I had the privilege of working with students, telling them this exact story, and I'll tell you what I told them. Mental health nursing changed me, and I didn't even want to give it a chance. I've since moved to ED to be closer to home with my kids, but mental health still has my heart. And now I get to challenge the stigma of mental illness in a new setting, because here's the truth. What mental health nursing has taught me: adaptability. Things can change in a minute. Humanity. Mental illness doesn't define a person. Compassion. You won't always understand someone's experience, but you can sit with them in their pain. Realism. You can't fix everyone, but you might say something that changes someone's life. Courage. Yes, it can be scary, but so is any job that matters. Honesty. It's okay to show emotion. People need to know you care. You won't always connect with every consumer. Some days will be hard. Some days you'll go home and ruminate everything in your head, wondering what you could have done better. But those are the days that make you a better nurse. So whether you end up in mental health or not, remember this. You too could get an early Christmas present that changes your life. Thank you, and good luck on your journey.
Thank you. That was really insightful, and I'm so grateful for you both for sharing your journey, so thank you. All right, now I'm going to speak with you about the process, and so this applies across nursing and midwifery students. What I'm hoping to share with you today is really critical information about our process, but also some key takeaways for you for your career planning for the rest of your life, applying for jobs, things to look out for, and things to just really make sure that you're across. So first of all, the dates are, opening and closing dates and offer dates are listed here. There are some other dates that we'll talk about, but these are all published within our handbook and our frequently asked questions. The other thing I just want you to be aware of is that SA Health offers a single offer-only model for TPPP. So you'll only be made one offer through this process, and if you decline that offer, you won't be made another one. So what that means is if you apply for Carlin and you get an offer for Carlin and you think, actually, I don't want that, I'm going to wait for an offer of Salin, you won't get another offer for Salin. So just be really mindful of that through the process. And if you have any questions, please, you can ask them at the end, or there's various different ways that you can speak with more people, speak to others about those options. Right, so we really want you to set yourself up to succeed. The best way that you can do that is to be prepared. So coming today is the first step in that. Familiarise yourself with our frequently asked questions and our handbook, which is on our website. Our website also has lots of different web tiles, information about the local health networks that others have spoken about. So when you go to our website, you'll either be taken to nursing or midwifery, and then from there there's web tiles for every one of the LHNs. So all of those LHNs that we've spoken about today, and that information will distill information session times, rotations available, things like that. Another trick for lifelong job applications is to just decide which email address you're going to use and stick with it. What we see sometimes is that people will might apply with their uni email now, and then when offers come out in September, you might be on holiday or you're not monitoring that, and you might miss some correspondence. So just decide which one you're going to use and run with that. Seek out your referees now and ask them if they're both willing and going to be available to provide you with a reference. We'll talk about that process, but if your referee is going to be away or not able to provide your reference during that time, I would strongly recommend that you ask someone else. We really want to be on top of that. We also want to respect our referee's time. Somebody mentioned that there's a referee last year had to provide references for nearly 50 students, and so we want to make sure people have got enough time to provide this information, and then also that they remember you, that they've got some capacity to think, yep, okay, this is some feedback I can provide, so it's really valuable feedback. Within our application process, you can apply for up to 3 different jobs in one application. So whether that's mid or nursing, and we call them preferences. So we encourage you to preference as widely as you can, because that will enhance your chance of getting an offer. If you only preference one location, and for example, just because we've already spoken about it today, for example, if you preference Salin midwifery as your only job, you've got a 1 in 12 chance of getting that job. So that's what we mean when we say preference widely, so that you've got an increased chance of getting an offer. And if you completed secondary schooling outside of Australia or outside of an English-speaking country, please just check in with AHPRA as to what your requirements are in terms of meeting the registration requirement for the English language standard. That's something that we noticed last year for 2025 TPPPs. There were quite a few barriers for some candidates, and so we just want you to be across that as early as possible. So for an SA Health application, there are 3 aspects. You will first submit your application via our SA Health Careers website, and if you, I think that you'll be given a link, but also if you just search SA Health TPPP, that will come up, and from the 2nd of June, applications will be open. I would always encourage you to apply for a job as soon as is possible to the application opening date, because particularly without our portal, you can save your application and go back to it. So what that means is if you hit a snag or you have some IT troubles or you think, oh crap, I don't have that document, I need to find that, you've got time, all right? So always try and submit early. The other aspect is that once you submit your application, it will trigger the next two parts. And your application isn't considered complete until all three of these components are finalised. So we'll talk about each of those now. I've already spoken about the application process. The application form will ask you lots of different questions, and the handbook provides information around particular documents that you might want to make sure that you've got ahead of time. Referee checks. Like I said, make contact with the people that you would like to have your referees. I think that you're going to get a copy of these slides, so I can see people taking photos, which is totally fine, but we'll also share the slides as well. Please refer to the handbook for the definitions of who suitable referees are. We really encourage you to use at least one clinical referee. That's mandatory, and the information about that is in the handbook. And again, life advice in terms of choosing a referee. Referees are asked questions like, they'll be asked to provide insight into your clinical skills, your abilities, your communication style, your interpersonal skills, things like that. So think about who might be able to provide a positive reflection on those skills. The next stage of the interview is an online interview. Now, you will also receive an SMS or an email to prompt you to do this step of the process. This step is done through a platform called VidCruiter. So that's something that we export to, and there are opportunities for you to do mock interviews. So please don't be concerned. There's plenty of opportunity for you to do practice. Another tip is that you can often practice interview questions in front of the mirror, or you can record yourself and watch it back, and that's a really good way of getting feedback on how you answer questions. It takes a lot of practice, like anything. You'll probably find yourself saying like and but it all just comes with practice, and so running it through a couple of times can really help. We suggest that you allow an hour to complete that step of the process. And just note, you're not allowed to use Bluetooth wireless earphones, just because we have found some candidates that's interfered with the quality of the interview. So you just use your ordinary speakers. And we find that the most reliable sources are laptops or desktops rather than phones. So they're just some tips. Interview questions generally will always be behavioural based. So you could do any search online, behavioural interview questions, and you'll get heaps of examples. Generally the themes are around communication, teamwork, and those other things that are listed. What we would encourage you to do and to start thinking about now is ways that you can really reflect on your experience in answering your questions. And things will come up in your career that you will keep in your memory bank. You'll think, this is a really good example of a time where I had to have a really difficult conversation with a colleague, or we really needed to foster positive teamwork within our team. And we encourage you to reflect on those examples through your answers. There are also 3 introductory questions, which are the get to know you questions, and where you might be able to tell us more about yourselves, and they're not scored. So it's again another way of you warming up and warming into the process. But do feel free to share about yourself in that aspect. We presented at UniSA earlier in the week, and one of the tips that Alyssa imparted with everyone was, do treat it like a professional interview. So even though you're at home, you're online, it's not dissimilar to, my daughter does ballet and she's 7, but they have to have the bun and they have to have the leotard. And it's all about being present in that moment and being ready to perform. So if you are in your pyjamas, you're probably not going to perform as well as if you get yourself dressed, you're all ready, pretend like you're attending a face-to-face interview. I didn't see these, but there have been instances of people walking behind people, perhaps with no clothes on, pets and things. So just be aware, it is just like a normal interview, and you really be prepared, and you will perform really well if you are ready. This is what VidCruiter, the platform, will look like. So this is just to give you an idea of what you can expect to see. There will be time limits on the questions that you have to answer, and you'll be given a countdown. If you have any tech issues whatsoever, you can access tech support 24/7. We've had some questions already about whether people can access this platform if they're overseas, and yes, you absolutely can. You just need a stable internet connection, and that's probably true for travelling across Australia as well. Now, while applications are due on the Friday, the 20th of June, we've given you until Tuesday, the 24th of June, to complete these steps. So what I really want you to do is apply early, but the last date to apply is the 20th, and if you do apply on the 20th, you'll have the weekend to complete these next steps. But please try not to, because if you encounter any errors or things go on, you just want to give yourself as much time as possible. Alrighty, selecting your preferences. Some of you might already have a plan of how you would like to preference your positions. You've heard a lot about our information sessions from every individual LHN. Please attend them, review the web tiles, you can understand the rotations available. Also, just take note of the various intake dates that are at each site. So some LHNs will have just one intake date, and some will have various intake dates from January through to May-ish. So that information is also available on their website. And we would always encourage anyone in any profession, when you're applying, to have a backup plan. So like the example I gave earlier of just applying for one job, I would always encourage you to apply as widely as you're comfortable, but we don't want you to apply for jobs that you never intend to take, because that will mean others will miss out. As much as we want you to apply regionally, please don't apply if you don't genuinely intend to relocate there. It's also a waste of your single offer, if you like. It means that you won't get offered a position that you would actually want to take. All right, this is some transparency around how we score candidates. So the online interview is weighted at 75%, the referee checks 20, and the GPA 5. And lots of candidates are interested in how we allocate people to jobs. So your full score, you'll be ranked 1 to 1,300, and it is literally a case of the first ranked person will get their first preference until all of those first preferences are filled, and then we'll go to second preferences. So your performance really does affect where you will be allocated. Alrighty, this is just a summary of the key things that I've spoken about and that I'd really like you to take away. Know the key dates. Now, there's an error in this, and so I will adjust it and send a copy through for everybody. But you can edit your preferences and your English language documentation until the 17th of July. We've brought that date back so that we can manage those changes. We give you that extra buffer, one, because we know that some people have a lot of trouble sitting their English language tests, and two, because you find out more information about what you might want to do. You might have a placement coming up, and that might impact what your preferences are. So that's the 17th of July. Again, familiarise yourself with our content that's available, contact your referees, don't share interview questions. That is just general life advice. I sat on an interview panel once where it was really obvious that 2 candidates had shared interview questions, and I can't tell you how disappointing that is. someone that's recruiting for a position, but also it's really dumb because if you share your interview questions with your friend, the chances are they might do better than you and they might get the job. So definitely don't do that, ever. You'll be given, we have a whole library of questions, so you'll be given a random selection. Your questions, though, will match your first preference, so they will be slightly tailored. So, for example, if you preference mental health as your first preference, you'll have slightly mental health tailored questions. There are questions about criminal history in the application form, but you do not need to upload any evidence. We've talked about those things. Now, if you have any questions whatsoever, please look for them first in our resources, but otherwise you can always contact us. There's a jobs@sa.gov email, and we will do our best to get back to you as quickly as possible. But yes, do try and look for the answers on our website first. Now, we have run over, I'm sorry, but we now have some time for questions.
Sorry, can I just jump
straight
in?
Yes.
Just around those preferences, so you talked from 1 to 1,300 as a fictional number. So let's say you've put your first preference in and then you've done your allocations. Do you then go down to people's second preference if they haven't got the... could you just explain what happens, how that sort of flows down?
Yeah, sure. So say Flinders has got 100 positions and the people that are ranked 1 to 100 have all ranked Flinders, then those 100 people will all get those 100 Flinders positions. And then person ranked 101 might have preferenced Flinders first and the RA second. So then they would be allocated to the RA. Does that make sense? Yeah.
Thanks. Now, a couple of questions. We'll just be quick because we're time to finish up.
Is there an option to do 6 months metro, 6 months rural, or split it kind of thing?
Oh, I so badly wish that was available. We've toyed with that a few times, but to be honest with you, the rental crisis is probably the reason that can't happen. Good luck finding a rental for 6 months anywhere, but no, we don't. Sorry.
Okay, thank you. Next question.
We have done it for midwives in the past, but it's probably been pre-COVID.
Okay, so that response was it has been done for midwives in the past, but that was pre-COVID. Next question.
Earlier you mentioned the relocation benefits for moving. Where can we find those?
Of course. So there's information on the SA Health website if you search SA Health relocation costs, but I'll give you a quick summary. So it's site dependent, but essentially it is up to $15,000 reimbursement, and it depends on the location. So it's 10, 13, 15, the further you go, and you'd be reimbursed. So it's not $15,000, it's up to, depending on what expenses you've incurred.
Yeah, good question.
Do you have any advice for us? We're on our first week of placement for this year, and these applications are due in a few weeks. We haven't got to know anyone yet or done any of our PARs, so we're a bit worried about getting feedback and references and things like that when we're only in our first week.
I would speak to the team now and explain the situation. You do have a couple of weeks to go, so it's the 23rd today, so it's nearly a month. Also, perhaps speak with your education team as well. They might have some tips. Yeah.
Hi. In terms of when we get the offer, are we told what our rotations will be?
It depends on the LHN, but typically I would say no.
And will the contracts after the TPPP year be ongoing, or is it just a 12-month contract?
It depends on the LHN, I will say. And because SA Health is so large, it's a moving beast all the time. in terms of what positions are available ongoing. I would say that a vast majority of SA Health positions will be offered ongoing in 2026, but that is something that you could ask at the information sessions of a particular LHN that you're interested in.
That's a good idea. Philippa? Yeah. Someone has asked about the mental health stream. So could you have a first preference for the mental health stream and then have a second preference for a generalised TPPP?
Absolutely, yes.
Okay, I have another question.
All right, we might need to finish up the questions. So, Philippa, did you want to do one more from online?
Is it just a resume they're uploading?
Yes.
No cover letters?
No cover letter.
Yeah.
Okay, good. And one here?
I was told by some new grad that she didn't accept the offer because it's a rural area, and she got the offer for Metro on second round. Can it happen in this year?
No, so it shouldn't happen. What does sometimes happen is that LHNs will fill TPPP positions with non-TPPP, so they'll fill them with RM1s, but it won't be within the formal TPPP program. But certainly it's a single offer, and it's all coordinated through the one application process through our team.
Okay, one more question?
I just heard the rotation between the hospital and the prison. So is this the same string as the mental health TPPP?
Did you say hospital and the prison?
Yeah, and prison, yeah.
Yeah. I believe that will be a Carlin rotation, and I think it's separate. So perhaps just, if you get in touch with Carlin around the information, have a look on their website. They've got lots of detailed information. Yeah.
Just another quick one, sorry, for the mental health stream, because this is new this year. Do they need to have experience at all?
If there are other questions, we'd be really happy to take them and collate. If you want to collate them and send them through, I can answer them.
What's the easiest way, Philippa?
It's up to you.
I mean,
we will direct as you have
Yeah.
asked us to, and they can probably go through that channel. We just don't want to miss anything, but we are directing to the handbook. Obviously, we've got these slides available, the recording, and obviously however you've asked us to direct as well.
Yeah.
So
we probably do prefer that they contact you directly, because then they
and that
get
is
the
our
answer
preference.
from you. So,
But if there are particular things or themes,
themes we can start to. But please do continue to direct your questions directly, as SA Health would like you to, in all the information. We'll give a round of applause. Thank you very much to all of you for coming and presenting. Just while we're changing over, I will just share with you on our Careers Flinders Insta. So it is Flinders Careers. We have SA Health. We've got links. So we've got the TPPP handbook, FAQs, the LHN page.
The LHN pages to keep up to date with the information session.
And the info session.
Yeah, and how to use those pages.
Thanks, Tracy. All right, so thanks everyone. Hopefully this is all very helpful for you. I was just saying on our Flinders Careers Insta bio, we've got all of that information linked for you. Did you do Teams? Now, how are we going?
Oh, good. We're up.
We're all ready?
Yep.
Yeah, great.
So we're saying questions to go just by saying
All right, now get some mics here. All right, so now we have St Andrew's Hospital staff. We have Francis and Amrit, and they're going to talk you through and talk about St Andrew's. Here's a mic if you'd like to share that, and you can just flip the slides as you need, if that's okay.
Cool.
Yeah, great. Thank you very much.
Hello everyone, how are you going? Long day, bit brain dead probably. My name's Francis, as you said. And this is Amrit, who is one of our grads from last year who's currently working in our proc suite. So we're going to quickly go over some information for you guys, but try and maximise question time. A little bit about myself. I actually did my grad program at St Andrews about 10 years ago. In the middle there, I went and did midwifery at Flinders, actually, and did a grad program at Women's and Kids as well in midwifery, and then decided to come back to St Andrews because it's the best hospital ever. So a little bit about me. Amrit's going to go through her story a little bit in a minute, but I'm just going to quickly talk about the program and what we have to offer you guys. So can I have a raise of hands if anyone's heard of St Andrews before? Oh, that's pretty good. That was better than uni, I say. So a lot of people, don't tell them I said that. A lot of people haven't heard about St Andrews because it's quite a quiet achiever in the back corner of the city. So we're just located on the corner of South Terrace and Hutt Street, and we own kind of a lot of the buildings and medical centres along on South Terrace. So people think we don't do much. However, we do basically everything other than delivering babies and eye surgeries. We make babies because in petri dishes, because we do IVF procedures at St Andrews as well. But if you're thinking that you don't want to go private because you want to see the big wide world and there's only big wide world stuff out in public, that's not necessarily the case. We do heaps of interesting stuff at St Andrews. We have lots of opportunities. So we have lots of beds, lots of surgeries, and last year we employed 25 graduate nurses in our program. That's including peri-op and the ward stream. We take local and international applicants, and we want to make sure that if you are applying, you have completed your studies in the last 2 years. So a little bit about our program. It's a 52-week program, and then at the completion of the GMP or TPPP, you will have guaranteed ongoing employment. We like to get you guys to choose where you want to go. So if you do 2 rotations and you're on the ward and one of them doesn't really stand out to you, you can negotiate with us and we'll see if we can facilitate you to go to another area. We do 2 intakes every year. So we start in early February and then another one in March. Again, you negotiate with us what works well for you. And I guess the main thing I want to drive home today is we're not as big as the big public hospital sort of programs that are offered, but we are really committed to making sure that you guys are well supported. So that is pretty much key to our philosophy as a hospital. We want you to thrive, we want you to be the best nurses that you can be, and we work very closely with you to make sure that you are well supported. I am kind of relentless in making sure that you are looked after well. So I do regular laps every day of the hospital. I come and check on you. We do weekly catch-up clubs out in the garden. If you want to just talk to me for any reason, I'm pretty much there for you 24/7. We've got educators out in the wards, and then we have allocated preceptors as well to support you. We also have 5 study days throughout the year, so they're paid, they're part of your FTE and your workload. You don't have to do an extra shift to make up for the time that takes, and we try and make them really engaging and sort of tailored to what you guys want to know. So we change them up all the time. We usually take people at a 0.8 FTE, so that's 8 shifts a fortnight. And we find that's a good sweet spot to not work too much, but also make sure that you've got enough opportunity to consolidate. The rest is kind of on the website. I don't want to harp on too much. You can all read, I'm sure. But I do want to harp on about one thing, which is our free parking around the hospital. There's heaps of free parking available, or we have a secure on-site car park as well. That's about $5 before tax, so it works out to about $3.50 after tax that you can pay for as well, because I know parking is a big issue. And we do Fun Scrub Fridays, as you can see, which is a big draw card. While I'm talking about the programs, I just want you guys to have a read about some of the feedback we got from our program last year. Again, you can see the common denominator is support, which is really important to us. We offer 2 programs, so there's a 12-month perioperative stream. You'll either do Scout Scrub for the year, or you'll do anaesthetics recovery, or you'll do what Amrit did, which is a procedural suite rotation. So that's working in day of surgery, procedural suite, and our second stage recovery. And then later in the year, there is room for you to go and work in the scope rooms, doing a little bit of Scout Scrub work as well. I'm going to go to the next slide, unless you want to keep reading all that lovely feedback. The other program, which is what I run, is the 12-month ward program. So we have 2 6-month rotations. We take very seriously your preferences and what you'd like to do, and we work very hard to make sure we honour that as well. So you can choose what's interesting to you. I really wanted to go to cardiac unit. They didn't have room for me to go there, so I went to ICU, and I've stayed there for 10 years. So don't get too hung up on your preferences. Don't think it's going to be the end of the world if you don't get what you want. The world and universe has a mystical way of making sure you're in the right place. So this is the QR code that everyone will probably want. If you miss it, that's okay. You just go to our website, go to careers, graduate program, and there's all the information on the website as well. We have a pretty comprehensive application guide that I would recommend reading. The main thing about the application is that people get this wrong every year. We want 2 documents from you. The first document that you will upload as your CV is your cover letter and your CV or your resume as one document. If you're not sure how to do that, you must ask, okay? Because there's only 2 places to upload documents. In the cover letter upload section, you must upload your application form, which can be found on the application page of the website. So make sure you're following instructions carefully. Please don't address a letter to ACHA and send it to us. Please don't say you really want to work at Calvary and send it to St Andrews. Be really careful about what you're doing. Get someone to proofread it and make sure you're paying attention to the finer details, because that will make your application stand out really well. We have 2 information evenings, 10th and 17th of June, so if you want more information, come along. We'll be there with the educators. We give you a bit more detail about the program. You can get to know us a bit and ask any questions. I will say about applying, don't put all your eggs in one basket. If you're not sure about St Andrews and you just want to see what it's like, I would recommend applying. Last year we had a bunch of Flinders students that came just at the end of our application process, and after their first week they went, oh my gosh, this is amazing, I love it here, I wish I'd applied, and it was a bit late. So don't rule it out. If you're not sure, I'd just recommend applying just to give it a go. We are going to ask for at least 3 referees. Again, with referees, ask around and get lots and lots of people, so you've got lots of people you can count on, because you never know if someone's just going to ghost you or never reply to any of your messages again. We will only contact your referees after the interview process, so make sure that you get in contact with them again when we tell you we're going to contact referees. And I would also suggest maybe sending them a picture of yourself so they remember who you are, because we've had a few people that we've contacted that have no idea who you are. Interviews will be group interviews with about 8 people. It's very informal. We just want to know you as a person. We just want to know what you're interested in and what makes you sort of passionate about nursing. It's not too rigorous, and most people go, oh, is that it? And then they leave and they feel really good. So that's hopefully your experience too. Again, not going to harp on about this, but we want to make sure the people who are applying and get these positions are paying attention to detail, really passionate about good nursing care, want to sort of make sure that they're part of a really cohesive team that's dedicated to our patients. Yeah, everything's on the website. I'm going to hand you over to Amrit now, but we'll have questions at the end. There we go.
That would be me. Hi, I'm Amrit. First of all, I'd like to congratulate every one of you here sitting in this room for making it to your end of your nursing degree. You've done it. And thank you for having me here today. It wasn't too long ago when I was sitting where you're sitting today, having kind of the similar kinds of emotion, a little bit of excitement, a little bit of nervousness, and a lot of self-doubt. I was questioning whether I was ready to be the nurse, whether I was ready to look after my patients at their most vulnerable. When I started my graduate year at St Andrews Hospital, I soon realised that from the structured orientation week to our fabulous graduate coordinator, Francis, to our experienced preceptors and a very welcoming, supportive team, I was never truly alone. I was not only encouraged to ask for support and ask questions, but I was also praised for it. We have some of the very experienced nurses working in our hospital that have been there for decades, that are just the wealth of knowledge. They have not only just answered all of my questions very patiently, but throughout the year, they have taught me to think critically, analyse optimise my own practice and be confident in my own clinical judgment as well. So one of the things that has really stood out for me during my graduate year at St Andrews Hospital is the supportive team environment. Everyone is very supportive, welcoming. Everyone is always checking up on you, making sure that your day is going okay, that your week's going okay, and you're enjoying your graduate year. And Francis is always lingering around in our wards, checking up on us, making sure that we're doing okay, checking if we need anything, if there's a skill that we want to practice, or if you're feeling a bit overwhelmed during the shift, then she's always there to help. And I'm sorry for speaking on behalf of Francis, but I am talking from my own experience, and she's always there. Another thing about St Andrews Hospitals is the opportunity for clinical development and professional development and education opportunities. Throughout the graduate year, we've had 5 study days. These days are tailored specifically for us so that they can help us. We've got to, during those days, we got to come off the floor, practice the clinical skills that we wanted to, that were relevant to us, play some fun games, get to know each other, and sort of do a debrief with each other and see how everyone is doing, because that's how you get the support from your other graduates as well, when you compare notes and when you see that everyone is sort of on the same boat, that you know that you're going in the right direction. So those things have been really important for my own personal growth as well, and there's heaps of online learning and competencies that you want to do. I'm always encouraged to do so if I want to. Clinically speaking, I've worked in various areas, second stage recovery, DOSA, admissions, and procedural suites. Being the private hospital, we get to work alongside a wide range of specialists, from surgeons to physicians to allied health professionals. Being exposed to that kind of multidisciplinary team has not only helped me improve my clinical knowledge, but also to deepen my understanding of holistic and patient-centred care. It shows how different roles come together and how to effectively communicate within this multidisciplinary team and how to advocate for your patients in more informed ways. It is an incredible learning environment where you sharpen your clinical judgment, but you also learn to advocate for your patients because you have that more knowledge, you have that power from this multidisciplinary team. One of the other things that I want to point out about doing my graduate year at St Andrews Hospital is the main thing really is the supportive environment. There's always checking up on you. I just want to give an example. I've started scrubbing in the rooms recently. It's been a recent thing in the past few weeks. So yesterday I was setting up the room for the beginning of the list, and out of nowhere I had 3 nurses come in to check up on me to make sure that I was okay, make sure that I had everything I needed. So this is the kind of support you get every day, and at the end of the day there's always someone telling you what a great job you did today, you did so well, and that sort of thing. We do have internal staff recognition program that you get recognised for the work that you put in. So this is the hospital that will welcome you, that will support you, that will challenge you as well. Also will invest in your personal growth and your career growth. So if you're looking for that kind of working environment for your graduate year, I believe that St Andrews is truly the place to start your graduate year. And choosing to do my graduate year at St Andrews has made all the difference for me. Before I wrap it up, I do want to mention how convenient it is to have an underground parking space and cafeteria that serves amazing food. It's buffet lunch and dinner. It's staff discounted price, okay? $9 for all you can eat. All right? So I'm just going to wrap it up there. If you have any questions, we'll take questions. We do want to focus on answering your questions.
Yeah. A super quick one while the mic's getting to this lady. You mentioned salaries. Are they anywhere to be found? Like, can people find?
So it'll be on the application form. We go through salaries at the interview process as well, but we do offer competitive salary sacrifice benefits, and then once you consider we can salary sacrifice more than the public hospitals, you're not paying $1 billion for parking, we kind of work out pretty evenly. So we go through that in a bit more detail at the information evening and at the interview, but information is available on the website.
Hi, thank you so much for coming. I just wanted to ask you, for people who are on student visa, obviously they're not allowed to work full-time or part-time, but once we finish our uni, we would be able to with our further visa. So what's your process around it? And do you have any priority grouping regarding, like, do you prefer domestic students over international students?
As Francis has already mentioned that we do take international students, I just want to point out that I was an international student when I started my graduate year at St Andrews Hospital, so okay? We don't have any bias against your visa. As long as you can sort it out yourself, it is your responsibility that you look into getting your visa for the next step, but we don't have that bias.
Thank you.
Any other questions?
Any online? No. I would just say your sessions are coming up as well. You have got your own information sessions, which again, everyone's going to get circulated a link with everything in there, the slides from today, any extra sessions these employers are running. So these guys do have their own instance if you want to go along to that as well.
Yeah. If there's anything you can't find on our website or the application form, please just email me. I am happy. You call me, email me, I'll be there. I just would love to get to know you all and have you all there next year. So thank you for having us.
Thank you. So if you can go to those information sessions, go, because they'll be really good to be able to chat a bit more. Thanks so much. Pardon? Oh, great. And our Career Hub has the information about the sessions as well. Okay, next one. All right, so now I'd like to welcome Tracy and Brooke from Burnside Hospital. Thank you very much for coming. The microphone is on. And here are your slides, so if you're happy to click through when you want to.
So hello, my name is Tracy. I'm a clinical educator at the Burnside Hospital Stepney site.
And my name's Brooke. I'm the clinical educator at the Toorak Gardens site at Burnside Hospital.
So Burnside Hospital is now over 2 sites. We have a Stepney site and a Toorak Gardens site. But both hospitals are now working in alignment and we both share the same commitment. Our mission is that we are going to provide exceptional care always to our patients. I'm not going to run through these slides in 100% full detail today, but you will get a copy of them. So I've put a bit more information so that you've got it there, but we're going to just do a quick run through. So we have our values that we run by. Could strongly recommend that when you're doing your application, you actually look at our values, our mission, and our vision, and put that within why you want to work at Burnside Hospital. And then I don't know if you're aware, the Burnside Hospital Stepney was actually SportsMed. SportsMed was acquired by Burnside Hospital Toorak Gardens in September 2023. All staff remained and all specialties remained the same as they were, except that we introduced plastic surgery into the Stepney site.
So we have a range of specialties that we have at both sites. I'm sure you guys can read there in front of you. So there is a big variety of, I guess, what you'll be exposed to and what you'll get to work within if you do a grad with us. As well, I wanted to say that even if you are applying, say, for a ward position or a perioperative position, that doesn't mean that you're going to be in that position the whole time. There is opportunity to move around and kind of get a little bit more exposure in those other areas, depending on what is going to be suitable for you. Is the next one?
So we also have our maternity graduates as well. So each year we take on 3 maternity graduates at the Toorak Gardens site. With that graduate program, we actually partner with the Lalmak Ewan Hospital, and they go there for their 5 study days, and they also do 2 weeks of their graduate program there as well. Over both sites, we employ 647 staff, and 240 of them are clinical staff now across both sites. So why would you want to work at Burnside? Just a few pointers that we've put in there. Like St Andrews, we can salary sacrifice, which makes a great benefit. We actually can do a higher rate of salary sacrifice, as was mentioned. We have an employee assistance program. We have physio consults that we can use throughout our employment per annum. They're capped per annum that you can use, which obviously everyone knows with nursing can be quite strenuous on the body. We are quite competitive with our salary. And one thing that you'll learn to know when you start your employment as a nurse, we have free car parking, which majority of the time is available, which makes a huge difference when you're trying to get to your shift on time and can just find a car park. We have an on-site cafe as well, which is amazing, and we have celebrations throughout the year. We do quite a few morning teas and barbecues for staff. We do a recognition of service. So, you're not just an employee and a number, you're actually a part of our team. And the Toorak Gardens site, with the agreement, they have the beautiful gardens that are not able to be built on or changed, so you've always got a nice area that you could go and have your breaks.
So I actually did my graduate position at Burnside and have been there since then. We offer graduate or TPPPs on the wards, which includes HDU, so there's an opportunity there to kind of upskill into that HDU as a support or a HDU1. We have the perioperative department, which includes scrub scout, anaesthetics, day surgery and recovery, and then of course we've got the maternity grad program as well. As I mentioned before though, just because you start in one, that doesn't restrict you from moving into other areas. So I know even in my grad year, I was on the wards and we would do shifts in day surgery, we would help out where we're needed, where we wanted to go, and we're kind of given the opportunity to lead our own grad program, if that makes sense. So we really rely on the grads to tell us what they actually want and what they actually need out of the program so that they can feel as though they can upskill and they can learn what what they're wanting to, what they're passionate about. And then that actually gives us a chance to move people around and so people get to see a few different areas as opposed to just being stuck in the one. We've got a few clinical educators on site that provide support, but we've also got our team leaders and clinical nurse coordinators on the ward that are always up there and, looking out for everyone. And most of our staff, maybe not most, a lot of our staff did do their grad position at Burnside. So everyone kind of comes from a point of understanding how it feels to be brand new and how it feels to need to learn things from scratch. So it is a really, really supportive environment. We've had a lot of enrolled nurses come through that have then gone on to do their registered nursing. So it's a real variety in terms of skill mix, but always there's support available for everyone.
And then I've just included a couple of feedback from our past graduates. So I won't run through that. One's from maternity and one had the opportunity of going through anaesthetics, recovery and day surgery. So they did 3 different areas within their 12 months. One thing that Brooke didn't mention, which is the most important, is our grad program is not just 12 months, it's ongoing employment. So you are guaranteed a job after your successful completion of your 12 months, which takes a lot of the stress off of your graduate year. But also, if you do your graduate year with us, and you say did it on the ward and did it in recovery and then you finished it and you've decided that now you want to give anaesthetics a go, it's not something that we're going to go, no, you finished your graduate year, we give you that option as well. Our 5 study days are tailored to our graduates for the year that we have, so if there's deficits in learning that you want to do or areas of the clinical setting that you want to learn more about, we tailor it to your requests. It's not just the same stock standard every year. And the last slide there, our applications are going to open on the 1st of September. We understand that SA Health is what all grads try to go for, so we're trying to make it that you know whether you've got what you really, really want or then come along to us. But we always encourage you to apply. And if you have SA Health offers as well and get that and have accepted something from us, when you make your choice, just be honest with the organisations. It's a small world, Adelaide. And we really can't stress as much that somewhere down the track you will meet us again. So if you're just honest with that you've got what you really want somewhere else or you want to take out, that's great as well. Just be honest. So so there it is there, the 1st of September. We're going to open up our website. It will be through the Burnside Hospital site, or it will also go onto Seek. We do ask you to do a video. Please make it professional, as they said to you before, because it does basically, that's how we judge and go by, because we get so many applications, we have to find a way to pick the best, really.
Thank you very much. Now we've got a few minutes for questions. So, anything that's caught your attention? Thank you. We'll just wait for the mic to come up to you. Thanks, Tracy, up there.
With the maternity obstetrics program, is that only for midwives or for nursing staff as well?
Sorry, I didn't. Could you say that again? Sorry.
Sorry, with the maternity obstetrics side, is that only for midwives or is that for nursing staff as well?
Correct, yes, it's only for midwives.
Okay, no worries, thank you.
Any other questions? No, we're all questioned out, are we? So thank you. Thanks so much for coming. Yeah, really good. Thanks. And a round of applause. Thank you. Thanks. Yeah,
thank you very much.
All right, now for the finale, we have Resthaven staff here today. So I'd like to invite you two up and we hear from Aman and, am I saying Sarah? Yes, good, is that right? And Sarah. Sarah and Aman will speak to you. So we've got everything ready? Yes, great, thank you.
Good afternoon, everyone. Thank you so much for staying on to listen to our presentation. We will do our best to make it as entertaining as possible. I promise we won't dance because nobody needs to see that. So, why Resthaven? Why aged care? Resthaven, we've been around since 1935. We're actually celebrating our 90th anniversary this year. We are an aged care provider, so we provide services to people aged over 65. We take pride in what we do because we are a not-for-profit. We really focus on the care we provide to our clients in the community as well as in residential care. Our purpose is very much about providing outstanding care and support for older people and their carers. Before I continue, I was being very rude, I will introduce my colleague Aman, who is our clinical lead at our Marion Community Services. Has a wealth of experience and will be able to answer your very technical nursing questions from a recruitment perspective. I can help you with that. So, with Resthaven, we're very lucky that we have a very diverse community amongst our residents, our clients, our staff, our friends and other stakeholders. We have a workforce of over 3,900 people. When I started with Resthaven 5 years ago, that was around 2,700. So we've had a significant increase in employees. We are across South Australia. We are both in metro and regional, so we have offices in Mount Gambier, in the Riverland, down at Port Elliot. So we have 3,900 of us, 200 volunteers, and we work across 40 locations across South Australia. The big question today, and no doubt it's a question you're asking yourself as various organisations have presented to you today, why us? Why Resthaven? Why aged care? Being an RN at Resthaven, it's not just a job, it's a career. We provide that high quality support to older people. We are purpose driven, not profit driven, because we are a not-for-profit. As I mentioned, we have a very richly diverse community. And we're very much focused and really exemplify the ideas of inclusion and unity, embracing and respecting each other's beliefs. We have our employees come over from approximately 93 different countries, and our residents, 129, which is just absolutely amazing. We love that. And within our staff group, over 55% of our staff are born overseas, and with 51% of our staff speaking a language other than English. So again, very much being very inclusive, very, what's the word I'm looking for? We have languages, we have people, it's just an amazing, yeah, absolutely, thank you. I was looking for the word, multicultural, thank you, Aman. You're my wing woman, thank you very much. Fabulous. Okay, so coming down to it, I know we've had other presentations from other organisations around what opportunities there are at Resthaven. At Resthaven, yes, you can come in as an RN, but that doesn't mean that you will remain an RN. We have so many different other opportunities, and particularly in management as well. Some of our executive managers started as RNs, and that's something that we really, again, going back to this, something we do well. We promote from within. We provide development. We have a very strong learning and development area which can help you to assist with your studies. So just giving a very broad overview of the different types of nursing opportunities within Resthaven. So we have our residential services, which is your normal residential aged care. Then we have community services, of which both Aman and myself are part of, which is providing assistance to our clients in their homes. I'm not going to read through all of them, but that certainly gives you a bit of a broad indicative of what we do. Again, the TPPP, not the first time you've heard this phrase today. So we do also have a transition to professional practice program. It is a 12-month full-time contract. Like many other organisations, our next cohort will be starting in February 2026. Touching on what I spoke about a little bit earlier, we do have a very strong and quite excellent learning and development area within Resthaven. So new employees can take part in a mentoring program so you can feel supported as you develop your role. For our nursing and allied health staff, it really gives you an opportunity to consolidate the clinical skills that you have and develop very specialist skills. We talk about continence care, clinical nursing, palliative care and dementia care, amongst others. I also just want to take a moment. We had one of our fantastic palliative care nurses, Karen Gregory, recently receive a nursing award for excellence in providing palliative care. And as people get older, that is something, these are the conversations that we have, and Karen does an amazing job. And as I said, we also have a professional development fund that you can access to pursue postgrad studies. With our professional development fund, it's a little bit different than other organisations. Other organisations, you actually have to pay for and complete your studies, provide them with a receipt or a transcript, and then you'll receive some form of funding. Resthaven pays up front. Obviously doesn't pay for all of it, but will contribute in part to your studies so that you can offset any sort of financial commitments that you have. Now this is the bit I can talk about that I know essentially back to front, the recruitment process. To give you a little bit of an overview, this is what our compliance check process involves, a police check and medical, which we pay for. And that's across the board for all positions at Resthaven. We don't expect people to take on the financial burden of going along and getting their own police check or medical. We pay for that. We will ask you to provide us with reference checks, and I appreciate as nursing students you're doing placements, and often you're not necessarily at this point where you're doing paid work in nursing. Your placement supervisor is sufficient as a referee. Qualifications and visa check, and provision of vaccination evidence, if applicable. I'm just going to leave this up here for a moment for you to either take a photo or attempt to scan it. Well done if you can scan it. 10 points for you. All right, moving on. Ready? All right, we're at the end. Thank you so much. Any questions for us, or more importantly for Aman? That would be great.
So one question that I have is, do you have 4 or 7 training visa support for the regional areas?
That's a good question. So talking about sort of sponsored visa, We do have some programs currently through Dharma as part of a sponsored visa arrangement, but they are for existing RNs.
Therefore,
existing RNs, so people with qualifications at this point. That situation may change. In terms of, particularly when you're going through the TPPP program, we can certainly have that conversation with you.
You can what?
We can certainly have that conversation with you if that's your current visa arrangement.
Mm-hmm.
But outside of that, we do have Dharma for registered nurses.
Yeah. And just get both of you to hold your mics really close
Okay,
so that we
sure.
can, so we can hear.
Yeah, so one more question is, what sort of support would RNs, like new TPPP RNs would get as a new graduate nurse if we start?
Okay, so that's okay. So just to clarify, in the TPPP program or post TPPP? Okay.
Yeah.
So you are provided with quite extensive support through the TPPP program. Our conveyor of that program is a lady called Hannah, who actually manages that program. Unfortunately, is not here today. What I would suggest, if you want to come down after our presentation today, I can certainly give you some contact details and I can forward that query through. Hannah lives and breathes our TPPP program and is the guru. So I'm really focused on ensuring that you have the right information. So just come down and we'll have a conversation at the end.
Yeah, that would be great. Thank you. Were you next? Yeah. Thank you.
Hi, thank you so much for coming. I just wanted to ask you about the application process. Like, when do you start accepting applications, and about your interviews, if they're online, face-to-face, and when do they start?
Okay.
Thank you.
No, thank you. We will be looking to open applications around August of September of this year. The link that I put up there on the screen will take you through to our careers page. So I would encourage you just to touch base again every so often to see when the TPPP program, I stop saying TPPP program, opens, but usually around August, September.
What I might do as well is put Hannah's email address in the summary document that goes out as well. So if anyone had any other questions relating to visa or any other questions at all, we can pop that in there.
All right, now we'll give a round of applause. Thank you so much, both of you. Before we all rush off, Sarah and Aman are going to stay, which is great, so you'll be able to have a chat. I just wanted to summarise a few things from this morning, so well done for staying the whole time. You've done really well. It is a lot of information. Now, we will send out the summary of all this. So we send out a little package. There's going to be a recording. It's, as I said before, Tracy's put it on our Flinders Careers Insta, some links to certain information. So look out for some of the emails and posts and things. It's also on Career Hub. And you probably have seen over your years on Career Hub, we do have resources and information to help you with your resume, your cover letter, your video interview, your in-person interview. All of that is on Career Hub. So Philippa will send out a big package, won't we, like a summary of everything for you. So if you can just maybe work through that slowly. I know some of you might be on placement and everything, but bit by bit, and maybe work out when the application dates are, who's first, and go like that, and then you can focus. So is there anything else, Philippa?
So that summary will come out. It's a one-page summary, and it's got all the application open close dates. It's got the contact details from everyone here today who's provided. So Frances, for example, had her email address. Like they literally, a lot of them have given them their email address to you. So if you've got another question, the SA Health one is a generic email, so that's going to be, you're going out, but it will make its way back to Stacey. So that's a really good place to start, like Rihanna said, about prioritising, because it's got the open close dates and all of those bits of information. Everybody's slides from today are in there as well. So I would definitely use that as a resource. And the other thing is, a lot of you will have done an assessment piece already, which would have been creating your resume, and that's based off of these application processes. That's why it's embedded in your curriculum. So when you get to this point, you've got a little bit of a head start. So SA Health said they didn't need a cover letter. So just read things carefully. Some of the other organisations may, but just, each of the nuanced pages but each organisation will have their own separate guidelines.
I did just want to thank Kim Mildy as well for being here for this session. Thank you for your presence here. So I think if that's all, we will wrap up, and if I encourage you to come and speak to Sarah and Amand because they're here. So, you know, take the opportunity and just even have a chat. If you don't have a question, just come up and introduce yourself, have a bit of a chat. So thank you so much, everybody. It's been great to be here with you. Thanks.
That's all right.